Well, good morning. Good morning, ladies and gentlemen. And welcome to the public hearing on Government Reorganization Plan 2025, Day 2. Today is Thursday, April 24th, 2025. I'm Pedro Nava, Chair of the Little Hoover Commission. I want to thank you all for joining us today. This is the second and final day of hearings on the commission that is scheduled for our review of the Government Reorganization Plan. There are other commissioners joining us today. Gail Miller will be with us shortly, Gil Garcetti, Jana Sidley, Vice Chair Anthony Canella, Commissioners Jose Atilio Hernandez, Dion Aroner, and David Byer. We may be joined later by other members of the commission as well. Also with us is the commission staff, Deputy Executive Director Tamar Foster, Project Managers Crystal Beckham, and Daniel Harris McCoy, and analysts Ashley Hurley and Sharon McAllister. Got a little bit of housekeeping that we have to do. We're live streaming and recording today's hearing on Zoom. Following the hearing, staff will place a permanent link to the recording on our website and upload it to our YouTube channel. As with all commission meetings, we will have a public comment session at the end. Public comment will be limited to 3 minutes per speaker and for a total of 1 hour. If you are here with us in person and would like to make a public comment, please fill out the public comment slip and give it to one of our staff members. If you're joining us remotely and would like to make a public comment, please use the raise hand feature in Zoom. And now to the substance of today's hearing. Earlier this month, Governor Newsom submitted to our commission a plan to reorganize parts of California government. Under the governor's plan, the Business, Consumer Services, and Housing Agency would be split into 2 new agencies, the California Housing and Homelessness Agency and the Business and Consumer Services Agency. Under the state's government reorganization process, our commission is required by law to study the governor's proposal and to issue a report recommending whether it should be adopted. We take this statutory obligation seriously to produce a thorough and fair assessment of the governor's plan. And we believe our commission can provide an important perspective as the legislature considers whether the governor's proposal should take effect. In today's hearing, the commission will largely hear testimony focused on the proposed creation of a business and consumer services agency. The commission will first hear about the impact of this reorganization on local government from the California State Association of Counties. Next, we'll hear from a leading scholar who will share her research on how licensing boards operate and regulate industries. Before breaking for lunch at about 11:45, the commission will hear from industry advocates, including representatives from the Professional Beauty Federation of California and the California Society of CPAs. The hearing will resume at about 12:30 with testimony from the California Association of Realtors. We will conclude today's hearing with input from the Consumer Federation of America about how the proposed structural changes may impact consumer protections in the state. I want to thank the witnesses for any written materials that have been submitted. The commission has had the opportunity to review these materials, and I would ask you to briefly summarize the major points you want to make so that we can focus our time on discussion. If you are familiar with the commission's procedures, and I would let you know that it is in all likelihood you'll be interrupted during your presentation. Ask you to please don't be offended. It is actually a compliment because it means that the commissioners are engaged. They've listened to your testimony, reviewed some material, and have questions that they want to pose that are relevant and germane to that particular aspect of your testimony. I would also say to my fellow commissioners, because of the setup on the dais, sometimes it's hard for me to see you, to recognize that you want to speak. So if you can either get my attention or that of Ms. Foster, she'll let me know that you have an interest in asking a question or making a comment. So now I'd like to ask Deputy Director Tamar Foster to please introduce our first witness.
Thank you, Mr. Chair. Our first witness today is Graham Knaus. He's the Chief Executive Officer of the California State Association of Counties. Thank you for joining us.
Welcome.
Good morning. I first want to really thank the commission for the invitation, and the opportunity to share some comments about the proposed reorganization. From a county perspective, my comments will focus largely on the housing and homelessness parts of the current agency and the proposed split off of that into a new agency. And I want to begin with a little bit of context about the deep interdependent relationship between the state and counties. No state in the country has as complex and as interdependent a relationship between the state and counties as does California. And so as we think about this proposed reorg, our lens is that is the lens in which we are looking. And we're looking at that lens to ensure that we have the opportunity to most effectively deliver on the state's priorities. We serve as the primary service provider for the state of California. And so most services are delivered through counties either directly or through partnerships that we would have at the local level. And so that is 100% true related to housing and homelessness related programs. As we look at what has occurred over the last several years, there's been a very fast growth in the number of programs that are being managed at the state level. And that in turn means that the same thing is happening at the local level. And so we've added together a lot of new programs attached to that. And increasingly those programs have shifted from a prior model that was more direct allocation based to one in which it's a competitive grant related process. And so that is going to be material to some of my comments this morning as we look at this proposed reorganization. We have this unique combination, I think, of elevated public, governor, legislative attention on housing and homelessness, which is certainly true at the local level as well, and an environment in which we've created large swaths of new bureaucracy connected to it. And we're all frustrated. Public's frustrated, state's frustrated, counties are frustrated, our city colleagues are frustrated too, which means something is not quite right. And I think BCSH, which has many, but not all, of the programs around this, seems to wear multiple hats under its current construct. And there are things that have been added that are material to its overall work, and there are things that have been added that perhaps are not so. And so thinking about how to make the agency most effective, we believe that this proposed reorg is smart and would provide much greater focus in the work that is being done, in both as it relates to the licensing regulatory side and as it relates to creating a housing and homelessness agency. So really, I want to thank Secretary Moss actually and the administration for the unique thinking and the leadership around this to try to have a more focused approach to housing and homelessness. It's one of the things that is severely lacking, I think, in California and frankly in every other state in the country too. Secretary Moss has been an outstanding partner in trying to work through how best to deliver services at the local level and do this in partnership with the state. But I also want to talk about some of what I would encourage the commission to be thinking about relative to this reorg, which is
before you launch into that.
Yes, sir.
This is one of those interruptions I mentioned.
Great.
So Commissioner Sid.
Welcomed.
So I just have a quick question as the head of the Association for Counties. Is it possible for all the counties, for you to get together with all the counties and have one application form? I don't think you need to tell counties not to include things they want to include, but just have one and then share that with the state so that we can consolidate, where I'm hearing all these stories about people, oh, I put together 10 different binders, people asking 10 different things. I mean, even if they're still asking a billion things, if there's one binder that everybody then finishes and can just hand it to everybody, and why can't the counties get together and have one set of questions? Why can't you guys all coordinate and then coordinate with the state so that we can help consolidate what the application process is?
We are, I mean, essentially, our role is to respond and comply with what the state's direction is related to applying for different programs.
Yes, but you're also, aren't you sort of working with all the counties, and couldn't you get everyone together and say, hey, I see that Alameda has these requests, Los Angeles has these requests. Can we all consolidate? I'm not telling Los Angeles not to have their requests. I'm not telling Alameda not to have, but let's do one big list. And then when people are applying, they fill out the form once. Now, it may be that you're giving Los Angeles more information that they need, but who cares? But you would do it once for everybody, and there'd be one big binder. And it seems to me like you sit in the perfect situation to be able to coordinate with all the counties to try to get that consolidated.
So counties absolutely welcome what you're suggesting, which would be a far more efficient model in partnership with the state than what exists today. And I'll give a Santa Cruz example. In Santa Cruz, a Monterey County example. In Monterey County, they have a very successful rapid rehousing program. In order for them to fund that rapid rehousing program, it requires 8 different fund sources with 8 different applications, 4 different state departments, and all with different reporting requirements. And what you're suggesting would be a far more simple way for us to have a partnership with the state. It's what we want. And ultimately, I think it would move us from a place of process to one that's more focused on outcomes, which is our goal.
Okay, so you just said it's what we want. So what's the obstacle to get there? Why aren't we there?
We are required under state law to do it in the way that is currently structured.
Well, you're required to get the information. But why can't there be a universal application? And again, some people will be putting in more information than particular counties want, but there's a universal application to apply to UCs now, and then you pick your school and your top 3 choices or whatever. It seems to me like the state working with the counties can also do a universal application. And again, I might be giving more information to a particular county than they really want, but I do it once, and I got one huge binder. The people are still doing the work that they have to do, but they do it once. And then they just keep sending they Xerox their binder, and here's Alameda, it just seems so much more efficient. And it seems you as, sort of the organization that works with all the counties, that you could convene that and try to put together a universal application.
We are currently working on a pilot for housing and homelessness, a pilot structure that would do exactly that. We cannot put it in place without the state adopting it because it would require multiple changes in state law, but that where there would be one unified application that counties and cities would do together related to homelessness. And that would take the place of 6 different applications and departments and reporting requirements. And would have a very focused set of outcomes that the public understands in terms of the metrics that we are tracking, and would allow a much greater focus on delivery of services rather than hiring people to submit applications. And so we are looking to do that very thing. There are a number of other components to this concept, but it's to your very point, which is there is so much well-intended but heavy bureaucratic layers that we are required to sift through while we're being held accountable for a system that's almost required inefficiency. And so we believe, and this is, we've had very positive conversations with Secretary Moss and her team, and are thankful for their openness and leadership in this space in understanding that we have to get out of our own way. And the getting out of our own way means we need to focus a lot more on outcomes and a lot less on process. There's opportunity to do that. I believe that the reorg is an opportunity to create a reset in this very space where you have an agency that is specifically focused on housing and homelessness, that has a more consolidated approach to it. And in the reorg, there's a component of it that is specific to housing that would do that very thing, where it would be one application as opposed to a number of them. We believe the same thing should occur on the homelessness side, because there are so many different programs, and we're just one player. Cities have a relationship with the state on that issue. Continuums of care have a relationship with the state on that issue. And so we're just one player, but it is our board chambers that get filled when there isn't more progress being made. And we want to ensure that we have the authority, the flexibility, and the resources to deliver what the state is asking for.
Commissioner Byer, then Commissioner Garcetti.
Thank you for your testimony. If I could make a metaphor here, and I'm eventually going to focus just on homelessness, but for purpose of this question, assume it's housing and homelessness. We have a patient that is the housing gap in California, and it's gone to a building, and in the building, one half of it is using a chainsaw to change government, and the other half wants to use scalpels. So I'm going to try and stay on the scalpel side of the equation, if you get the illusion. And Atul Gawande, a very smart doctor, created a checklist, and he said, okay, if you're going to try and improve surgery, you can't let the surgeons pick where the instruments are going to be on the tray. You have to give them what they want within a certain parameter, but you can't have such variation that it gets in the way of positive surgical outcomes. And so it seems like yesterday and today, we're about trying to create a forum that permits people to use scalpels, not chainsaws, but we have to have an end goal in mind. And so I want to focus on homelessness. The voters very narrowly approved Prop 1, and maybe you could help us by describing from the perspective of a homeless person what Prop 1 means with respect to the prospects of their getting housing. Who's got to do what to alleviate the unsheltered nature of that person? And who's going to touch the process, starting with the people who show up as social service workers, police officers, firefighters, how they have to relate to each other, and then layer in which level of government is supervising that intervention to get to the housing. So just maybe a narrative. Thank you.
Certainly. Thank you for the question, and the scalpel example. I like that. We believe in scalpels rather than chainsaws. The way that Proposition 1 is structured, if you are homeless and you do not have a behavioral health issue or significant substance abuse issue, and Proposition 1 is not going to do anything for you. That's not how it is structured. And so there's a bit of a false belief that that Prop 1 and homelessness are interchangeable in terms of the population served, and that is not accurate. There are a number of individuals who are homeless and have significant issues that will make them eligible for Proposition 1 related behavioral health housing or services 100%. So that is true. But counties also have responsibility for the broader population of children with severe mental illness and older adults who may be working with severe mental illness. And those two are part of our responsibilities under Proposition 1. So it's much broader overall. We welcome the investment in housing, behavioral health housing in Proposition 1. Those dollars will begin to go out the door in July. And our hope is that the dollars get out the door as quickly as possible, and we're able to move forward with putting facilities in place. There remain other barriers that we are seeking to address to make it faster at the local level as it relates to what the process is to approve a project, because it is a very, very lengthy process.
So let me drill down on Sacramento. So I'm on the board of the Steinberg Institute, so I know Darrell Steinberg, former mayor. It took him 3 years, more or less, to get an agreement between the city and the county to, and I'm not blaming anybody, but it was a negotiation between people who have responsibility of providing a certain kinds of service, the city and the county, to get people to be on the same page. So back to my homeless person, that let's just assume that they have substance abuse or mental health issues. To get them from where they are to being in housing requires coordination at the top of the house, at the state level, on the homeless council, right? And then at the local level between the city and the county, the different departments within those, and then with the state. And what I'm trying to get a picture of, without going to, a single point panacea, how do you instill a sense of urgency to improve outcomes without getting distracted by moving the org chart in a reorganization context? In other words, how do the government providers keep an eye on the ultimate goal and not get distracted by the new office here and the new executive director there? How are you going to, as counties, how are you going to help that happen?
So I will tell you that there are two fundamental barriers to making progress on homelessness that have not been addressed, and I'll speak to those in just a second. The reorg, we believe, has great possibility, but in and of itself, it doesn't solve a problem. The problem that you were describing, which is about what's happening on the ground in terms of service delivery. The two fundamental problems that exist related to homelessness are, first and foremost, there are zero responsibilities in statute around who's supposed to do what related to homelessness. Zero. So what's different about, and that is unique, when you think about child welfare, K-12 education, our criminal justice system, higher ed, any transportation, any other policy area at the state level, there's a construct in state law about who's supposed to do what work. And that is not true for homelessness. So if you have an individual, the other piece of that is that there's a piecemeal approach of submit a 3-year plan and we will give you 1 year's worth of funding and hold you accountable for the 3 years worth of outcomes. And so that's a challenge that we are working through as well. But the fundamental piece is that ultimately no one is really responsible. And we think that needs to change. And we have a proposal that would change that so that there are defined responsibilities for the state, cities, and counties. So if one of the three parties fails, you know exactly who and what, and then they can be held accountable. Currently, there's not real accountability because there aren't real responsibilities. And so if you have an individual, say, on the doorstep of the CSAC building, who I see on a regular basis, if you have an individual there, they have their stuff strewn all over the place. Whose responsibility is it for that person? County behavioral health has interacted with them multiple times. They know the individual, but he is not eligible to be coerced into receiving. He's not sufficiently mentally ill to warrant a more extreme intervention. And so he cannot be compelled to receive services. There's a downtown partnership. Are they responsible? Is it the continuum of care? Is it the city? Is it the county? Is it somebody else? And the reality is that's not spelled out anywhere in state law. And so if that's not spelled out, how do we get to a place of actually expecting different results? And so what we're trying to solve for is that. And in order to do that, we strongly believe there must be defined responsibilities linked to funding and accountability in state law. And if this new agency helps create greater focus and leadership in that space, then it will be a profound change, and we would absolutely welcome it and work with the administration to put it in place.
So last question on this. How does the proposed new department relate to the Department of Health and Human Services and the homeless services that are in their purview and with their money? How does that happen, and how do the counties relate to that process of integration?
As I mentioned at the beginning, we have a very complex and interdependent relationship with the state. And so we work very closely with Secretary Johnson in Health and Human Services and her teams, because we are delivering Health and Human Services on behalf of the state. That system is much broader than the homelessness related programs and efforts within this proposed new agency, and serving many Californians. And so we will continue to have that relationship. The focus here, I think, is to have an area that is more concentrated around homelessness than we have had in California, so that we're clear on what we're trying to accomplish and what it takes to get there. And my hope is that in that, it addresses this fundamental lack of clear responsibilities for each level of government, because we will otherwise never make sufficient progress. And I say that intentionally. We will never make significant progress on homelessness, and particularly street homelessness, unless it is crystal clear who is supposed to do what, and that whatever that entity is, there is funding that is aligned in order to accomplish that, and the flexibility, because communities are different. And we don't have that in place. No state in the country has it in place, but no state in the country has as profound a crisis around homelessness as California. So this is the place, I think, where it should happen. And there's an innovative spirit in California, and we encourage that to be directed towards putting a structure in place. And so that is exactly what we're hoping to do. And what I can tell you is that there are a number of local agencies, counties with cities within those counties that want to do something different together. And that's not true in all places of the state, for sure. There's a lot of conflict on this issue, but there are places that are willing to do something that is dramatically different, where there are clear responsibilities, that there's funding that is attached to that, and that there's clear accountability if you fail. And those are things that we think there's a proof of concept potential that is perfectly aligned with the creation of this new agency under the reorg, that we believe could really put California in a leadership position and make some material and sustainable progress on homelessness.
We've got Commissioner Garcetti and then Commissioner Eriner. And let me just say, with respect to what you have identified as the lack of accountability with respect to the state, the city, and the county, what we all understand that leads to is a level of frustration by members of the public that then point to all levels of government and say, this does not work, which then leads to the next step, which is give us the strong man that can fix it. That's where it goes. If we don't get our arms around being able to address this in the way that you've described, it leads far beyond what we have imagined in a place that I don't think any of us ever want to occupy. Commissioner Garcetti.
Thank you. Knaus, I think the county should be very proud of you as a spokesperson. You are a very articulate, impressive person who has the information that we need for this hearing. I've learned from you already today, the short time you've been here. How long have you held this position?
7 years.
It's much longer than I would have expected. This has to be a really, really tough position. When you have 58 counties with different points of view, and it's up to you to try and get them together. I don't know if you go by majority vote on issues or it has to be 2/3 vote or unanimous vote, but that is a tough job that you have. But thank you for undertaking it. People like you are not known to the community, but without people like you, we would not be as rich of a state we have. The focus I have today for you, and you've answered it a little bit, is how specifically do the counties benefit if this reorganization takes place with regard to the homeless? That's the only issue. How specifically would they benefit?
We would specifically benefit by having a far more focused leadership around homelessness and programs that are housed under one roof rather than being in disparate places. We would also hope for what is proposed on the housing side, where there are multiple programs that would be effectively collapsed into one application. The same thing would begin to occur under the homelessness programs that are underneath the proposed new umbrella agency, because ultimately bureaucracy should be working to produce outcomes, and to the degree that it is a barrier, and we believe it is a barrier in this as it relates to homelessness, we need to remove it. And we need to remove it in ways that focus on what we're trying to accomplish, which is making progress, material progress that the public can see on homelessness on the street, and to do so with clear accountability. And so that's our hope. There is a lot of conversation about accountability as it relates to homelessness. There has been for the past few years. It's just been disconnected from who has what authority and level of resources to do it. And we are just one entity in this. And so there are other players that are material that receive their own funding for this. And so there needs to be coordination among all of that. And I will tell you that in the places that it is working the best because the locals have figured out a way to create what probably should exist in state law, which is a framework, and not a framework that provides clarity of responsibility and authority, that has reliable funding attached to it, and that has sufficient flexibility so that if you are in Merced or Del Norte or you're in San Diego, that it is that you have the flexibility to do it in a way that makes sense in your community. And so that's happening in some places, but it's not happening in enough, because there is a huge disincentive in the way that dollars are going out the door, and the bureaucratic structures that are there for folks to actually work together. And that is hugely problematic, and we believe can be addressed, and it's not in the state's
Graham,
interest.
give us an example of that.
Los Angeles.
Well, no, but it's got to be more than just talking about LA. I mean, kind of say, here's an example of why this, exactly what you just said, because I need an example of.
So it goes to the scenario I referenced related to the individual that's on the street. We see them every day. We're walking around them. They're blocking traffic. They have significant issues. We all know that, and yet no one is ultimately responsible for that individual. So how do you ensure that there's a system in place where that initial homelessness outreach is owned by some entity?
So give an example. Where is it working?
It's working well in San Luis Obispo County. In San Luis Obispo County, the county and the 7 cities within the county have been coordinated well And so they are making some progress. Their scale is a lot smaller than it is in some of the more urbanized areas. But they are making material progress because they're all working together. It's in most urban areas, it's really, really hard because of the lack of structure that is in place. And I think the county and city of Riverside are working their way through it. They're probably best positioned as an urban as an urban community, and they're having very difficult conversations about where one's responsibility may stop and the other's begins. But those are all being determined locally in an incredibly difficult environment where the dollars are not aligned to, and some of the authority isn't aligned to any of that. So they're just trying to figure out some way to make it work because there's nothing in state law that would structure it.
We got Commissioner Erner, I think you have something, and also followed
So-
by Vice Chair Canella.
So I remember doing the first hearing on homelessness, right? We did it in the late 80s, right? The federal government had cut off, housing dollars, right? And we started seeing people on the streets. And the legislature did a hearing, which I staffed actually. So we're now talking about, that's 30, 25, 35, a little bit over 35 years ago, right? And here we are. Appears to be with a much larger problem than we knew about in those days, right? It just kind of started happening then. And so I'm trying to figure out, because one of the problems is our lack of sense of, somebody has a sense of urgency, but somebody doesn't, right? The public has a sense of urgency. They are exhausted, right? We all are, right? Who do I give my dollar to today, right? Who's sitting in front of Pete's on Solano Avenue? Do I give it to that guy today, or do I wait until tomorrow? Or do I go and buy him the cup of coffee, right? Instead of giving him the dollar? All of those kinds of things. If there was a real sense of urgency, right, then I guess I'm worried that we create the agency, and it does theoretically, it makes absolute sense to me. I get it, right? These are two different kinds of things that are happening in this same overall agency, and they're not really linked to each other. Okay. There are some other agencies though that also have responsibilities. You mentioned, HHS, the treasurer's office has responsibilities because of some of the funding and all of those kinds of things. And the reorg plan doesn't really address that, right? Because this is just about one big agency being split into two. But whether or not, is it the way you're talking, right? Which I appreciate completely, right? I mean, I've lived through interagency agreements and integration of services, right? Did the first bill on integration of services, right, with counties. And the problem was counties had no example of an integration of services, meaning the state had no integration of services. And today pretty much still doesn't have much integration of services. So you ask local governments to do it on their own, and they say, but wait a minute, you guys are all siloed. Why, it's hard for us to do something in an integrated way. But what I'm hearing from you is, and I guess the question is what timing are we talking about? Are we talking about something where there is a proposal in front of the legislature today to deal with the issues that you're talking about? Or is it going to be tomorrow or whatever? Because the public can't stand much more. I mean, which is a very sad statement, right? Because we should all be caring for each other, but it's hard, right? And particularly for family members who are facing, as you know, right, watching their family members, right, just fall apart in front of them, and they don't know what to do about it. And so what's the sense of urgency? What's the timeline we're talking about? Are we talking about something where we think at the end of this legislative session, you will have the statutory language that you need in order to be able to be more flexible, to start holding jurisdictions accountable? Or are we talking about next year? Does the reorg have to happen first before you all do that? Because that to me says that the public sense of urgency is not being met.
Yep. So thank you for your comments and your question around that. We can't do this in a sequential order. It doesn't make sense because of the point that you made, which is the public is very, very frustrated.
Yeah.
And they're not alone.
No, we all are.
Everyone's frustrated. Yeah. So there's no need to wait. We have So some of what I'm talking about, and we have other policy proposals that would be connected to this sort of proof and concept pilot that it's ready to go. There are 9 counties with multiple cities in those counties that would sign up to do this tomorrow if it were signed into law. It's not in a bill. And so we've had a number of conversations and we've been working on this for some time. So we get it. We're slightly out of sync with the legislative process. The frustration is what has driven us to try to develop something that would be uniquely different. And so there are other components to this beyond the responsibilities. There's CEQA stuff and by right and I mean all sorts of things that are attached to it. And there is language ready to go that could be in a trailer bill, that could be in a legislative vehicle. So we're having active conversations, but it's not in a bill today. And the reason why we're having active conversations today is because we don't believe that we can wait until we start next legislative session. We need to integrate ideas now because we have to start functioning differently. I will say, as it relates to HAP, a couple of years ago, the trailer bill, AB 129, that included HAP had.
What's, you guys say, don't use that.
I'm sorry.
What's happening?
The HAP is it's $1 billion a year. It's the Housing Homelessness Accountability Program. And so that is the most flexible and successful pot of funding that has been used around homelessness. And the reason why is because it now includes a structure where folks have to figure out who's responsible for what locally. But that is not written in state law. It's connected to a grant that you have to apply for. So it's not exactly what we need overall, but it's at least a step in the right direction. And so there's that structure that is in place. But we have to move beyond just that piece to actually put a construct in statute, or else in 3 years, we're all going to be having this same conversation again. And the public has had it, and they're right. They're absolutely right. And so there's a way to do this that's not comfortable for counties. It's not comfortable for cities. It's not comfortable for the state. And maybe that means it's about right. But currently, there is funding going to different entities that may or may not be doing work that's moving in the same direction. And so that's part of the challenge here counties have broad HHS related responsibilities, as you all know. We are but one player as it relates to homelessness. And so we have very limited control over what's moving in what direction. And cities would likely argue the same thing. And perhaps the same is true for the continuums of care that have some role in this as well. But the dollars that are going out the door are not aligned to the level of frustration that shows up in the county board chambers. And so we want to fundamentally change and shake up the way that the state and us are approaching homelessness so that we can make real progress. And so I'll just mention one other place where it's working decently well, which is in Stanislaus County with the city of Modesto. They had to create, it's always the Central Valley that figures that out.
And Vice Chair Canella does have something he wants to add, but go ahead.
I wanted to cue him up first. In Stanislaus, it's all relationship based. So the places where they've been able to make more progress is because they've focused heavily on investing in the relationships and where folks are doing things that make them uncomfortable. They created a new entity, effectively completely separate from the continuum of care, which was not super functional. And so the county, the city of Modesto, the business community, the health plans, the faith-based community, they're all working together and they're working together and determining who's, who has what level of role, what resources they might bring in order to do that. And that's an awesome model. They shouldn't have to figure all that out on their own, and to do it without significant ongoing support from the state. So we think that there are places like that can really test out in relatively short order a different model where you have authority locally that eliminates some of the bureaucracy. We've been meeting with the nonprofit developers to try to help reduce the time and the cost related to putting in permanent supportive housing facilities and interim housing, and in connecting with both cities and counties in terms of what can happen. Because ultimately at the local level, it's in a city council or at the county board where the public is going to show up. They will not show up anywhere else because they don't know where else to go. It's the cities and counties that ultimately hold the accountability bag, whether we have resources or authority or not. And so we're trying to have a more balanced system where we are effective partners with the state. And this reorg doesn't do that. What I'm saying is it's a bigger thing, but the spirit of this reorg is very consistent with what I'm talking through here on behalf of counties.
Vice Chair Cannell.
Great. Thank you for being here. So first off, you mentioned on affordable housing that I think you said 8 binders are necessary when you're processing for funding. So if this reorg goes through, what will that be reduced down? Will that be a manageable level, or do you have any ideas on what the reduction of paperwork will be?
My hope is that it's one.
One. Wow. Okay.
So-
that's first we've heard of that. So that is
That's always my
significant.
hope.
Yeah.
I mean, I am.
Is that hope based on like a hope, or is it based on what you've read and then heard?
There clearly would be a reduction based upon the proposal. So there would be less bureaucracy specific to the housing piece than there is today. That's positive. That's not true on the homelessness front, but it is true on the housing front. And we need to do that even more so. We also need to have real conversations about barriers that have been collectively created over many years about how long it takes. So we may have one, even if we're successful in getting to one application, funding comes in, that is awesome. You still have to figure out how to get a project approved and then how to have that project pencil out. And it's because we have a severe housing problem, as you all know, here in California. And part of that is about the cost of units, but part of that is also about the amount of time that it takes in order to get something online. And we think that needs to be substantially reduced, and that there are some opportunities to do so. They're not comfortable. And so we and others would certainly have to struggle through that conversation, but we have to make changes in how long it takes to get something in a community, or else we'll never get there. We are so far behind. We're getting further behind each year as it relates to housing, and so it's only going to get worse until we address some of the barriers that are in the way, even if we get to the one.
Yeah. Just quick follow-up. You mentioned on homelessness, you've been very careful to insert funding anytime you talk about, the solution. So if only this reorganization happens and there's not additional funding, will it still be successful?
I think the reorg would be a positive step. It doesn't, if there's not additional funding or additional flexibility of existing funding, then that just materially, we would not have any additional resources to make additional progress. But if it's a step towards having clarity about who is doing what level of work, that would be positive. The current model is required inefficiency, because you submit a 3-year plan just specific to the housing homelessness accountability program. You submit a 3-year plan, you get 1-year funding. You don't know if you're going to get funding in the second year. And so you hedge. And so what you end up doing, what most communities end up doing, is they invest in things that are not long-term in nature. And that is a terrible way to address what is a long-term problem. And so we are very inefficiently, by design, utilizing the funds that are coming in. And so there's a more effective way to use those dollars if there was assurance that they were actually going to continue to flow. So I think that could materially change it. That would certainly be our hope. That's more of like a hope, but would look forward to that kind of change for sure.
Okay, we have another witness on deck. However, I wanted to, if you need another 5 minutes to conclude any additional comments, but as you can see from questions from the commission, I think that you've answered some of the questions that we have. But I don't know if you have anything else, and if you do, if you need another 5, that's okay.
I have
But
a 28 slide.
okay, good then. We'll be back here tomorrow.
I'll be in the room by myself, I think.
Right.
No, I really want to thank the commission for the robust dialogue. It's very helpful. You clearly take your role very seriously. It's really important. These reorganizations are huge and they touch on very important issues to the state of California. I am thankful for the leadership of Secretary Moss because she's been a really great partner for us in trying to navigate what is a very complex set of programs and often competing priorities, and that the reorg will help have greater focus in these areas. That's very positive. That on its own doesn't solve all the issues that we have raised today, but I do think the commission has an opportunity to weigh in on what we're trying to accomplish part of this, because ultimately, whatever the org chart looks like, at the end of the day, it's about what you are accomplishing and what outcomes you're trying to achieve. And we believe the fundamental focus on homelessness needs to be about having a clear structure that is in state law. And I say that representing an organization that we are in our 130th year, and we don't typically, and both Dion and Anthony would know this well. We do not typically ask the legislature to put something in statute that requires anybody to do anything. That's not our nature. And in this case, we are, because there must be clarity in statute or else we all continue to fail. And in many communities, we are being held accountable whether we're able to make progress or not. And so there has to be a way to make that change, and the state is perfectly positioned. And Secretary Moss is the right leader for this new agency to make it happen. And my hope is that the governor and the legislature then goes steps further relative to ensuring California is the model for how you effectively address street homelessness in this state.
And that's a perfect conclusion. Thank you very much.
Thank you very much.
Tomorrow, I think we have another witness that's remote.
Yes, we do. Our next witness this morning is Rebecca Allensworth. She's the Associate Dean for Research at the David Daniels Allen Distinguished Chair of Law at Vanderbilt University. She'll be joining us online.
Hi there.
Hello and welcome.
Thank you. So I first want to thank you for having me here. I'm so delighted to be asked to give my opinion about what's happening in California. And the reason why I've been invited is because I just wrote a book on the very thing that you guys are getting ready to do. And this book says that the professional licensing system is broken, and it doesn't appear to be any less broken in California. The proposal, as I read it, is kind of a shuffling around of the licensing boards that are currently in California. And I would like to urge you to take this opportunity as kind of a once in a lifetime opportunity to really do something more, to do something more than just make the, and I had to write this down because they sound exactly the same to me, to make the Department of Consumer Affairs, which oversees the licensing boards, into the Business and Consumer Services Agency, which would oversee the same licensing boards with the same basic structure. Let me first tell you why I think this is so important. So 1 in 5 American workers have to have a professional license. That's about 3 million Californians. The stakes are really high for workers who get locked out by this system, and also for consumers who, in like the best case scenario, have to pay a huge tax for bad licensing policy. And in the worst case scenario, don't get access to the professional services at all. That's kind of what is bad about having too much licensing, which the current system does encourage. But there's also a huge problem with too little regulation. So there's the way in which everything is structured now kind of leads to an unacceptable risk of bad providers being kept in the profession and kept in the system. So what's the heart of the problem? Well, this is where I think this opportunity is really special, because I wrote the whole book about how the real heart of the problem is not the laws on the books at the legislature, but rather on the regulatory apparatus that we use to oversee this system. Basically, the very thing that your commission is tasked with reorganizing. That's the professional licensing board. So professional licensing boards in all states, and to some degree in California, and I'm happy to be more granular on that, are self-regulatory. They're made up of members of the profession. They're kind of volunteering their time. They're not paid. They moonlight as their own regulators. They have no experience in regulation, and they have no time to really dedicate the kind of attention you would expect a real regulator to give to it. This sort of autonomous self-regulatory structure has put not the state in charge of professional licensing, but the professional association in charge of professional licensing. And so if we don't do more, I think, than what this proposal contemplates, I think it'll be a real step sideways. And California is a really big state. It's a really important state, and I think that they could do something different. I will break down the arguments of my book and try to connect them to problems that are concrete in California. So as I said, this structure gives associations authority over professional licensing. I spoke to a patient advocate in California, and she confirmed for me what I found in other states, which is the CMA, the California Medical Association, really has a hold on the medical board. This structure tends to lead to a ratchet effect. So over the years, the barriers to entry get bigger and bigger and bigger. I found a story in California about a man who tried to start a new business, helping protect people's email accounts from too much spam. Well, he was told he needed 6,000 hours of experience before he could become a private investigator, which is what apparently the board believed his business represented. This structure leads to turf wars. Maybe one of the most bitter turf wars that we've seen is between the California Medical Association and the California Association of Nurse Practitioners. These boards focus on turf, and they don't focus on consumers and patients. Too much regulation, as a result in part of these turf wars, leads to incredible scarcity. This is a huge problem in healthcare. I want to note that California ranks 25th in the nation among the states for access to healthcare. That sounds okay until you realize that every state, almost every state that is ranked below California, is either heavily Republican, heavily rural, or both. This in a state that has some of the most restrictive licensing rules perpetuated by these boards in healthcare. There's also a huge problem for the equity of workers. Some of the people hardest hit by licensing excesses are people who traditionally experience discrimination. One big example of this is people who are re-entering society after doing time. California releases 1 million people from jails and prisons every year. And the jobs that would be most important here would be the low-income professions. But California ranks second to worst in the nation in terms of high barriers for low-income professions, kind of cutting off the accessibility to millions of jobs to people with criminal histories in a world in which recidivism is most predicted by joblessness.
Dean, this is Pedro Nava, the chair. I have a question or a comment from Commissioner Byer. And I apologize, but I did suggest that witnesses would be interrupted from time to time.
Absolutely. I'm happy to be interrupted.
Thank you.
Thank you, and thank you for your book. I look forward to reading it. I ordered it yesterday, but have not yet read it. In 2016, this commission issued a report on occupational licensing, which you probably read. And we made a series of recommendations, particularly focused on members of the military, where they or a spouse was licensed in a state and then they move into California, and there are barriers to entry for them. People who are licensed in a foreign country move here, and we have a shortage of nurses or therapists or things like that. And then finally, the point you've already made about former offenders. So we're familiar with the issue, but our report, notwithstanding its bipartisan support, everything from the Wall Street Journal editorials to left, center, or progressive groups, basically nothing happened. And so I want to talk to you about how to use the opportunity of this reorganization to add a feature in a different bill. In other words, we can't reform licensing in this bill, but we could encourage the legislature to take up recommendations from our earlier bill or other things. Have you seen a state or a country intelligently, in a focused way, alter licensing parameters to avoid the problems you're talking about in a way that enhances consumer protection, lowers costs of services, or increases employment in occupations where there's a desperate shortage causing price increases and the like? In other words, is there a model that California could look at and say to the new head of this new agency, here are 3 or 4 things you should do, and you should either report to the legislature a series of reforms? If you had that mandate, what would the reform effort look like, and what's the parallel from some other state or country?
Okay, so I think that the reason why the licensing reforms haven't gone anywhere, and it's not just California that's had this trouble, has to do with this licensing board structure. So to me, the most important thing is that the licensing board's
Right, I think we understand that.
Oh, yeah.
The problem is that structure is dictated by the incumbents and their participation in a political process. What I'm trying to tease out is what's an argument that's going to appeal to the public that's going to overcome the entrenched power of incumbents who are already licensed? I mean, 99% of the time, you're going to have increased licensing requirements, more hours, more degrees, things like that. Yet on the other end of the spectrum, you have states like Pennsylvania, Maryland, Ohio, and yesterday, President Trump talking about eliminating licensing requirements because it's an impediment to economic growth. Those degree requirements, for example, are not been linked for almost 2/3 of state jobs in the states that I mentioned. Having a college degree is not really required. So if that's true, we have excessive licensing. How do you go about the process of reforming that, recognizing that the incumbents are going to be opposed to pretty much everything? So how do you build the case for reform?
Okay, well, that's a slightly different question. So you had asked me about models, and I think that the models that I looked at for my book included the UK, which does physician licensing very differently. Vermont is another state that attacks this particular structural problem that I identified. And because they look at the actual structure of how they do the regulation, they're able to get more substantive reform. So, for example, in the UK, the medical profession is overseen by a board that is not dominated by doctors, although there are a lot of doctors on the board. It's not over a majority. And they separate out and have much more strict kind of procedural and substantive hoops they must jump through to do discipline. And I actually was able to empirically compare one state, my home state of Tennessee, with the UK to see that this system, because it's structurally built differently, actually has better results in terms of getting the bad apple doctors out of the system. So to overhaul, but a separate question is what you just asked, which is if we decided we wanted to pursue something like what we have in the UK, or maybe something like what we have in Vermont, how will we sell it to the legislature? How will we sell it to lawmakers who for years have been, you know, kind of stuck in the lobbying efforts, stuck by the lobbying efforts of the professions? How do we build a case for this? Part of the point of my book was to, in a really sort of, I think, a pretty engaging and simple way, help people see just how terrible the system is so that they understand how desperate we are for change. Now, the American Medical Association is never going to agree. The professional associations are never going to agree. But if we get more stakeholder engagement, I think that, you know, if you understand how bad it really is, then you build the will. The other way that we do it is we talk about the financial impact of bad licensing policy on the state of California or on the US more generally. For example, I put a lot of the blame of the opioid crisis at the feet of the boards. Governor Newsom said in 2023 that he had spent over $1 billion trying to fight the opioid crisis in California. That's very expensive. One doctor who had assaulted 16,000 women and girls over the course of 26 years settled the suits against him, which was, by the way, a class action because there were so many victims, for $1.1 billion. He was a doctor at USC. But if he had been at UCLA, that would have been $1 billion out of the California fisc. So we need to think about the ways in which the licensing system we have now is how does this go? Penny wise, pound foolish. It's very inexpensive. Fixing it is going to be expensive. Fixing it is going to have a lot of headwinds against the professions for sure. But actually doing it right is going to require some money. We need to be thinking about how much in terms of access to care, cost of healthcare, and these sort of like one-off tragic, huge tort situations, which are, you know, allowed to happen by these boards, really cost society. And another point I'll make is this is very understudied. You know, I felt like a lone wolf out there writing about this stuff. You know, you have a lot of libertarians saying the kinds of things about how we need less regulation. Yes, that's been said for many, many years. But there's very little systematic study. You know, what I heard in the beginning of your question is, prove it, you know, show me that these other models, these other states work better. And we just don't have the kind of empirical data to show that that's true. We need to gather it and we need to learn more. So the short version of the answer to your question is, one, we need to reduce professional, the sort of professionals' interest and control over the licensing system itself. That's done through the regulatory design that I think a reorganization presents an opportunity to change. And two, we need to fully understand the cost of licensing as we do it now.
Yep, thank you very much. Please continue.
So I talked a little bit about what makes it so bad. I mean, what makes it so over-regulatory. And then there's a whole other problem about it being so under-regulatory. So I actually brought up the OBGYN, or actually he was not an OBGYN. He was a doctor at the student center who ended up costing USC $1.1 billion. California has faced a lot of scandals, including, you know, against its medical board. One of the medical board members was a whistleblower back in 2021. CBS News did a whole expose on that. I think the public is very interested in all those problems, and I think the public may be mobilized to actually do something about this. And another thing that I think is underappreciated is the ways in which this under-regulatory feature, the ways in which these self-regulating boards don't really give adequate consequences for the bad actors of their profession, tend to perpetuate the injustice and the inequities in especially the medical system. So if you get light licensing board discipline, you're likely just through the operations of the market to get shunted towards the more vulnerable populations if you don't get your ticket pulled by the board, which isn't typically what happens. That means that the worst professionals with the worst records are going to work in cash clinics, they're going to work with the uninsured, they're going to work in prisons. And other kind of institutional settings where they're likely to encounter the most vulnerable patients and clients. So what would I do to fix this? So as I said, we need to reduce the influence of the association, and you can do that through the structural reforms of changing the membership of the licensing boards. This would be unlike how it's done in other states, so we don't exactly have a model for this. One model I identified earlier was Vermont. Vermont has licensing boards that are advisory. So the licensing boards that are dominated by the professionals report up to a member of state government, a commissioner, and that person makes the final decision. Vermont is seen as a much lighter regulation state. So we don't have to give the final word on rules and also discipline to the profession itself. I think we need to separate the disciplinary process and adjudication from the rulemaking process in the first instance. This would be copying the system in the UK. So right now, there's a real incentive for the board to be very vague in their disciplinary rules because they're going to hear the individual cases. So they kind of make vague pronouncements about, well, it's a case-by-case basis, but also we don't like this and we don't like that. But then when they're faced with an actual case, they tend to go very light. I think if you had a separation of those two functions, which is sort of best practices in administrative law anyway, you would see the board making the rules being more specific and providing more guidance to the disciplinary tribunal that would be actually applying real standards in a way that made them more accountable. I think the discipline should not be dominated. It should not be done by panels dominated by members of the profession. And each step of the disciplinary process needs to have more lay and sort of bureaucratic even buy-in. And by that, I mean something other than what we call public members. So in California, there was a big push to have more public members on boards, and that actually happened. California is one of the states with the most public members. But public members have no criteria for appointment. And so they tend to be people who are owed a favor by the governor. I'd like to see a system where those public members were actually more specific, like it says, a patient advocate, or an opioid crisis expert, or somebody with expertise in regulation, some kind of statutory scheme. So for example, in Tennessee, our air quality board is made up from a sort of even mix of people who are likely to be polluters and an equal mix of people who are likely to be environmental advocates. Why not kind of balance the interests, bring all the stakeholders in a profession to have a voice at the board? I think for this to really work, you'd have to have economies of scale. I think the system that we have now that has proved so resistant to real reform, as you identified, breaks every profession into their own board, because that's what sociologically defines a profession. It's self-governance. And so the dental hygienists want to be separate from the dentists, and the nurses want to be separate from the physicians. I think this breeds the kind of turf wars and over-regulation as well as the under-regulation. And I think to achieve the economies of scale, you could combine some of these boards and reduce the membership of the professions to something lesser, where they would have the expertise that you need. You could consult the one or two members of that profession on the board if there was something specific that came up, but you would have a more holistic perspective on consumer protection. And I think the other big piece that we need is adequate funding. So there was a scandal a few years ago where the nursing board falsified its data about how it was having a ratio between the open investigations and the number of investigators on the case. This ultimately was caused, no excuses for fraud, but ultimately the problem here is a lack of resources. And this was maybe one of the most persistent findings in my research in writing the book. Boards do not have enough resources to do their work. And why is that? Because their resources to maintain a zero balance sheet with the California fisc or with any state's fisc, they're all funded through licensing fees. And so members of the profession have a conflict of interest. They don't want to raise licensing fees on their friends and on themselves. So they underfund their own work. And at the bottom, they feel like there's nothing really wrong with the way regulation is going now because it's basically going well for the profession. So I think the state has to bite the bullet, spend more money on this regulation, and do it right according to best principles. I think that the states that we have that we can look to for some of this is, as I said, Vermont, where the boards are advisory. the UK, where they have a much more rigorous system for physician discipline, and they really structurally reduce the influence of physicians in that process. New York has a similar disciplinary process, although it differs in ways that I think are important, that could serve as a model for importing the UK system to a state like California. And finally, Colorado has an overarching umbrella organization that oversees all of its licensing boards and provides a lot of expertise and analysis in how those boards work. And so that's essentially the comments that I have. I mean, I guess, you know, I don't know how this adds up to whether I would recommend that you recommend to the legislature that they accept or reject this proposal. As you pointed out, you could accept it, but with recommendations. I would be inclined to say, let's not just rearrange the boxes. Let's actually take the time to do this right.
I want to thank you very much, Dean. Let me turn to the commissioners. Any questions or comments from commissioners? Seeing none. Thank you so much. It does ring consistent with the Little Hoover Commission's report on issues with licensing. And many of the themes that you've discussed were reflected in our report as it relates to licensing and how, in fact, it may be a real impediment for others to be gainfully employed and to create careers for themselves, and especially the ones who need it the most. Thank you for your work.
Thank you.
All right, I'd like to now call up Mr. Fred Jones. He's the legal counsel and advocate with the Professional Beauty Federation of California, as well as Mr. Jason Fox, Vice President of Advocacy and Public Affairs for the California Society of Certified Public Accountants. Welcome. Thank you for being here.
Welcome. Glad to have you here. Make sure you got the green light.
That's better. Maybe for me, not for you. I'm Fred Jones. I've served the Professional Beauty Federation of California since the year 2000. So I have a quarter of a century of experience representing the beauty and barbering industry. In that time, I've missed only one state board of barbering and cosmetology meeting. So I consider myself a fairly diligent advocate. And most of our funds come from the little guys and gals of our industry, not big check writers. So I think I represent those that are making their livings behind the chair. I'll dispense with my 45-page introductory comments and kind of just play off initially what you just all heard. First of all, self-regulate. In California, most of our boards, but certainly the Board of Barbering and Cosmetology, is a majority non-industry appointed board. At least 90% of our nearly 100 employees in the State Board of Barbering and Cosmetology are non-licensees. We have a disciplinary review committee that has hundreds of cases every quarter that go after our licensees that are doing things wrong and dangerous. So we are anything but self-regulated. I only wish that my association controlled our State Board of Barbering and Cosmetology. We do not. In terms of barriers to entry, 2% of every California adult has a Board of Barbering and Cosmetology license. That's your family. Immediate family, maybe indirect family, but that's your family. 2% of every adult. Over 600,000 individuals in California have a State Board of Barbering and Cosmetology license. So don't talk to me about barriers to entry, because we're not doing a very good job of erecting those barriers to protect our interests, if that was the case. The professor mentioned the huge costs of torts. Well, that would be the wake of delicensing. That would be the wake of deregulating, because there would be no other recourse for harmed consumers but to hire a fork-tongued attorney like myself and to pursue litigation and costs to those that harmed my client. So licensing and regulation is actually a very effective way of maintaining standards and protecting consumers. Now, in 1950, 35% of the American workforce was unionized. Today, it's under 10%. In 1950, only 5% of the workforce required a license. Today, it's almost 30%. So there's a direct inverse relationship between unionization and licensure. As apprenticeship programs and standards that were maintained by private sector unions declined, the state moved in with licensing to fill that standards gap, to fill that responsibility and accountability deficit. So there's another purpose of licensure there, and that's to maintain the standards of these professions. That's my defensive pitch. Now let's go on the offensive side of things. There are opportunities to reform this new independent agency, and I'm looking specifically at Department of Consumer Affairs, and again, from our industry perspective. The State Board of Barbering and Cosmetology controls the curriculum, inspects the facilities and equipment of all of our schools and all of our apprenticeship programs. And in the apprenticeship programs, they actually provide the pre-apprenticeship education that all apprentices have to do before they go to work in a salon and earn while they learn. And that's an important avenue to licensure. You don't have to go through a school. You don't have to have Title IV loan money. You can actually earn money while you're learning as an apprentice after a 39-hour course that the state board provides. Every student, every apprentice, every licensee looks to the State Board of Barbering and Cosmetology as the regulatory agency. Yet, there are other agencies at the state level that regulate us. So for example, those schools, which more than 90% of our licensees go to become licensees, they not only have to be inspected and approved by the State Board of Barbering and Cosmetology, but they also have to be licensed by the Bureau of Private Post-Secondary Education, BPPE. Students, if they're harmed by a school, there's contractual violations. They're supposed to go to BPPE, but they all call the state board. That's all they know. It's the state board, because the state board controls the curriculum, they control the licensing exam, they control their future as licensees. It's been our long-held position, and even the State Board of Barbering and Cosmetology's official position, that all of the functions of BPPE vis-a-vis beauty and barbering colleges should be shifted under them, and whatever resources that can come with that. Our state board does an incredible job going after bad schools and protecting students, and they don't receive one dime from beauty colleges.
Let me interrupt you.
Go
We've
ahead.
got Commissioner Byer, followed by Commissioner Sidley.
Good morning. First, let's take the red herring off the table. No one's talking about delicensing anything. We're talking about how best to license. And so I'm going to switch from cosmetology and make it less personal to your occupation and focus on accounting.
Okay.
So accountants have been regulated for thousands of years.
The Board of Accountancy in California has been around since 1901. Cal CPA since 1903.
Virtually everyone will agree some degree of regulation is appropriate for accounting. It's probably the one profession where there's uniform agreement. You can maybe put doctors in,
Yeah.
sometimes lawyers, but maybe not. So accountants are regulated by state law, federal law, international standards, voluntary standards, have accreditations, et cetera. Has there ever been a 10-year period that the accounting profession did not go through some degree of reform on accreditation and licensing?
From a licensing standpoint,
From this general global gestalt. In other words, the Advisory Committee on Accounting Practices.
Sure.
And my point is,
it's a constantly evolving.
it's a constantly evolving thing. So we're not talking about wiping everything out, and we're not talking about status quo. What we have is a reorganization plan and an opportunity for the new department to change the way business is done in a way that makes sense for consumers and for the economy. That has consumer protection elements and it has professional standards. But there's nothing written in stone that the current system is working optimally. And so with that, I'm focusing on you. If you were in charge of changing the standards to make it easier, less expensive, less time consuming for people to apply for and get assurances around accreditation in barbering and cosmetology, would you keep a 1,000-hour standard for training?
Boy, there's a lot of issues for our industry in that question. So there's 1,000 hours for barbering and there's 1,000 hours for cosmetology. Those are two different animals. Cosmetology is the master license that allows someone to do not just hair services, by the way, includes sharp objects and chemicals, but also skincare and nail care. There's a lot of science, there's a lot of anatomy, there's a lot of issues with all three of those subcomponents of the master cosmetology license. We opposed dropping the master cosmetology down to 1,000 along with the barbering. We think it should be 1,200 or at least 1,200.
And is there a scientific basis for this position?
Well, the average, is there science? I don't know.
There's no peer-reviewed journal that suggests that this is the right standard.
The average of all 50 states is 1,500 hours for
Okay, well,
cosmetology.
that's not science. That's
I agree. I don't know if there's science on one side or the other. There's
so. Is there another way of looking at this, which is some of the inherent danger that you're guarding against is the use of harsh chemicals?
Mhm.
Would we be better off having this new department focus on the consumer protection side of banning or regulating the chemicals and either putting limits on who can use them or barring them altogether? In other words, we have what is going to be painted correctly some of the time, an occupation that has exposure to danger for themselves, cancer, their clients, horrible things. But maybe shouldn't we be looking at the causes of the potential harms as opposed to increasing the number of hours of regulatory scrutiny and training?
Yes, and we're open to that. As if there's a way to streamline the education to very specific nexus of scientific findings of consumer harm to specific services offered.
So we're in the process of eliminating 6 different food dyes because they're reportedly dangerous. So I guess what I'm getting at is one of the benefits of the reorganization is the combination of consumer affairs and licensing. And so that we can look at protecting consumers in 2 different ways instead of just focusing on occupational licensing.
Well, if I may offer from the accounting perspective, which again, different world than, your world over there. And as you can contemplate, the reorganization plan and how things structure and maybe a benefit of kind of how the current structure is working, where there's maybe some opportunities going forward. So we, from a Cal CPA standpoint, we're the professional association, represent CPAs. So your solo practitioners all the way up to big 4 accounting firms and everything in between. The demand for CPA services has been increasing. CPAs are doing a lot more work. The number of folks coming into the profession is flat, and we're going to be facing a significant retirement. Workforce challenges aren't unique to the CPA world. A lot of licensed professions are having those conversations. I think what's unique to the accounting world is that from the profession and the regulators, both in California and nationally, have been having some very honest conversations around what does that licensure model look like? And is it potentially creating a barrier or challenges for those entering the profession and creating a shortage, which creates consumer risk if there's not enough CPAs or CPAs doing quality work for consumer demands. So we actually have legislation going through in California and other legislation moving forward in other states that essentially modernizes the licensure structure to your point of going through this kind of evolving of what does the licensure model look like for 2025, 2030, and going forward, and is it responsive to the profession and consumer demands? And so we're making some fundamental shifts on how we approach licensure to make it more accessible, more flexible, more affordable. And I think the product of that, which I think is, rare in the sense of the profession and the regulators being very lockstep, and this makes the most sense from a licensure standpoint, is because working with our board in California, it's been very collaborative and it's been very, collegial from the standpoint of tackling problems together. Do we agree on everything? Certainly not, and that's okay, and that's part of the process. But I think having a dedicated board and dedicated staff that are able to invest the time and resources and understanding into a particular profession or occupation is helpful when you have the conversations from the staff side, but also from the appointed board members to say, we have a shared problem that's impacting consumers in the profession. How do we engage from that standpoint? And so I offer that as an example of how there's opportunities where the regulated profession and the regulators can be proactive in addressing challenges ahead of time. And again, that's the current system allows for that. And I think as you look at a reorganization, I can identify other opportunities that I think would kind of further that. But I just wanted to kind of offer that up.
Yeah, well, let me ask a couple of questions about accounting in particular. If you were a chartered accountant in the UK, what's the process you'd have to go through to get licensed in California?
Essentially, you would still need to meet the requirements to be licensed in California or whatever state you're in. Some of the things that you have done through your chartered accountant may also meet requirements in California, but you would still need to meet the California requirements for licensure. Having said that, the profession, while licensed locally in states, is a national and global profession. And there's been intentional coordination amongst the profession and the regulators in different states, different countries and whatnot, to be on the same page so that there's mechanisms for kind of cross-border practice and streamlined efficiencies there.
I agree.
Yeah.
And I actually know a bunch of chartered accountants from the UK who have served as CFOs of Fortune 50 companies. So the cross-border accreditation process is not all that onersome. But yes, you have to go through it, but it's not a gigantic impediment as it might be for some other occupations. And that speed bump can be years and hundreds of thousands of dollars and time and expense at a time when we have severe worker shortages in a whole bunch of professions. So as a mandate for a new organization, looking at those impediments, not for every occupation, to figure out how we can improve the economic well-being of California by having more people come in who are qualified and accredited based on their ex-US experience in licensing would seem like a good thing and would be consistent with the mandate to do consumer protection and advance the interest of the citizens. So I guess the tension isn't all around delicensing or altering or lowering the licenses and jeopardizing consumers. It's about a balance between how you make sure people have the qualifications, but also that you have enough people and that enough new people can join, given the problems we have with student debt and a whole bunch of other things that we don't have enough people coming into an occupation. So that's kind of the reorg mandate that I'm trying to get at.
I can't speak to the other boards and professions, but I could certainly from the CPA world that lives under the Department of Consumer Affairs and Agency, the mechanism in place have allowed for those conversations to happen to address those. I don't know if that's unique to our board or not, but I think there's a proof point that this system can work. Just a couple items I would offer as you kind of think about how do you support these examples and across the other boards is, I think one of the challenges that we've seen, and again, this is looking at it from a regulated profession, not knowing all the different interplays. I know this is much more complicated, but the regulatory process in California could be quite complex and quite challenging. I think that's probably an understatement. And so when boards need to pursue regulatory changes, minor regulatory changes or significant regulatory changes, for valid reasons, that process is long and onerous. And so if the Board of Accountancy wants to make changes related to implement a licensing change, and it's a year-long process, that doesn't seem appropriate. And so I don't know what that looks like. I know there's other players and other state functions that play into that, but I would argue the regulatory component should probably be better supported. The other piece is the technology. The Board of Accountancy, and I can speak from that standpoint, does the best it can within the box that they have, and the technology and having the resources to support boards to streamline systems and business modernizations, I think is important. I mean, it wasn't too long ago that licensees were paying their due or their renewals, the license renewals by check. And, when you have somebody that's, applying for licensure and they're, 23, how many 23-year-olds actually have a checkbook that are going to do it? So again, this wasn't from a lack of want and desire of boards to try to do it, but they work in a state ecosystem where technology implementations just have not been the best. And so to the degree those oversee the different boards to support their technology needs, I think is probably important. And then the last piece I would just kind of flag, and the prior speaker kind of alluded to some of this, the coordination of the professions, the regulated kind of entities in California with their counterparts in other states and from a national level, I think is important, because what we do in California can certainly help and shape the conversations in other states, and vice versa. If something's happening in Florida, New York, Texas, whatnot, that we need to be aware of from a standpoint of a regulation or consumer protection or whatever it might be, just to make sure we're still relevant, that's important. And to support our boards and board staff to participate in those national conversations, I think is critical from a consumer protection standpoint, but also helps them do their job. And so I know there's been challenges around, out-of-state travel, and can you attend this or not? I think there's certainly benefits for the regulated profession, but also benefits for the consumers to support the boards to be able to participate at that level. So those are just kind of three little items for your considerations.
Commissioner Sidley.
So Commissioner Byer asked most of my questions. I'm just curious, particularly where you, Mr. Jones, are suggesting, 1,000 hours, 1,200 hours, 1,600 hours. Do you guys track litigation? Do you track where people say they've been harmed through?
Yeah. No, and I don't think the state board does either. In fact, most, in our experience, anecdotal, when someone's harmed in a salon, there needs to be better communication to consumers about these regulatory agencies that can intercede on their behalf, because a significant number are settled privately. And I don't think the state board tracks those. I'm not sure how they would.
I'm going back to David's point that where's the data, the scientific analysis? Where'd you come up with 1,000 hours or 1,600 hours? So I'm looking for some data, and good data is, often litigation. And, what's the problem you're solving for that you need 1,000 hours or 1,600 or 1,500? And I'm not in that profession. I use it, but I'm not in it. So I just kind of, to me, it's arbitrary. And so I'm not saying it's right or wrong. I just don't know where it really comes from, per se. And to David, what David has sort of uncovered and here is, where do we come up with that number? And I think that it's not just your profession. I think, look, I'm a lawyer, and I have to go through continuing legal education, and I have my own requirements, and I get it. I'm not exactly sure where they came up with 25 hours every 3 years, but that's what I'm required to do, and that's what I do. So, so I'm just saying, and, as a lawyer, I would somewhat suggest that maybe 25 hours every 3 years where, are there continuing legal education for somebody in cosmetology? I have no idea, but so there's not. So you do your 1,000 hours and then you're done. So I'm just kind of, I think that as we go through this process, we might want to understand where we're coming up with these numbers and why.
I will say that we've been licensed in California since the 1920s. So we're part of that original 5% that was licensed last century. We're not a Johnny come lately to this. And there has been industry norms and standards that have been developed over the last 100 years. And that's what we would point to. Now, you could say that's inertia, that's arbitrary, but it's 100 years of precedence of here are the necessary amount of time it takes to make sure these folks have the minimum competencies, because that's all licensure is about. It's not being the greatest hairdresser or colorist. It's about minimum safety competency. And again, the average is 1,500 hours. 3 years ago, cosmetology in California was 1,600 hours. You may like to know, commissioners, that SB 803 was passed 3 years ago, and that's what reduced it down to 1,000. We as an industry would love to go away from clock hour altogether, go to competency-based, but that would require a more robust licensing exam to measure those minimum competencies. One of the problems of SB 803 is it did away with our hands-on practical examination. So before we move to competency and away from clock hour, we're going to have to beef up our licensing exam. The accountancy 4-part exam is incredibly industry specific and relevant and difficult. And so that's what we think we ought to move toward, is a competency-based education and a more robust licensing exam to measure those real-world competencies.
Just let me turn to the CPA. Did you have an opportunity to present the information you brought with you today?
I think I'm good. I'm happy to talk, but in the interest of the committee, answer any questions or we're good. I'm happy to be here and help support how we can.
Anybody else? Seeing none. Yes, please, Commissioner Aaron.
I just want to get on the issue regarding when somebody's made a claim, not a claim, but where we're talking about competencies, no matter what the industry is. And I think there were comments made about the fact that the same board that regulates also does the discipline, right?
Mm-hmm.
Why? And I find that troubling. I think that's problematic. And so we have an administrative law Office of Administrative Law that many other departments use in order to settle those kinds of disputes and things like that. Why wouldn't we just have that all done by the Office of Administrative Law? I know you're going to say if they don't have the competency to understand whatever. No, you know what, people can be trained, all right? And some things are common sense, okay? They just are. And so why wouldn't we just say that we would like to move that particular job or that task over to the Office of Administrative Law, where people would be trained, right? And whether or not the issue is accountancy, people get developed expertise in all kinds of things, right? Why wouldn't we do that?
Well, I'll offer some comments, not knowing, this is more of the Board of Accountancy, for them to kind of speak to their process. I will say, so within the CPA world, the board does have advisory committees that are made up of, technical professionals that can help be a sounding board for the board staff or to kind of help review their work to make sure very technical accounting issues are, the staff's in the right direction, if they miss anything and whatnot. The Board of Accountancy does use an administrative law judge to kind of help facilitate their petitioner hearings and whatnot. And so there is kind of that component, but, I would add that the board is, made up of governor's appointees and appointees from the legislature. It's a public majority board. We're the only public majority board, CPA board in the country. And I think, that is balancing the public interest perspective, asking questions that a CPA may not ask through a enforcement function or just general as they consider policies, I think has been helpful. But I also, to your point, having the technical CPAs there to help understand and provide their perspective is valuable on, very technical components. And so
But you could have that through the AOC process. I mean, the Office of Administrative Law, that would not be, I almost said AOC, isn't that interesting? Politics comes in everywhere.
Don't say anything about oligarchies.
Yeah, exactly. But that could be, I mean, that could could be taken care of, right? There could be people, you could get the
Yeah.
technical expertise you need through the Office of Administrative Law. I mean, there would be testimony, all of those kinds of things as well, because that's how that process works.
Yeah, I don't know how to answer that question, to be totally frank. But
Yeah,
please.
I'll push back a little, with all due respect.
Mm-hmm.
It does come down to competency and who understands the very regulations they're enforcing. However, there is an appellate process, as my colleague mentioned. So the way it works in our industry is there's a disciplinary review committee that reviews the actual violations and makes a judgment. And then if the licensee wants to appeal, that goes in front of the full board, but it's under the administrative law judge. And so all the constitutional rights, right to counsel, et cetera, apply. So there is kind of a combination of both, but our position in reforming is about consolidation. So as I was saying earlier, we would like to see more authority in our state board vis-a-vis our industry over our schooling, our apprenticeship programs, our disciplinary review processes. So we think we should consolidate more under the expertise of our various boards.
How many disciplinary actions do you have a year,
Um,
approximately?
It's the state board's function, not our industry association, but there's, I would say over 1,000 a year. I could get you those numbers. They're published every quarter at the board meetings. There's a lot.
Okay, I mean, I'd like to know, I mean,
Mhm.
I'm looking for data that supports whatever number of hours, and what problems we're solving for. And so numbers of problems would be, I think, helpful. Again, we need some data here.
I agree. And just on that point, I failed to mention, SB 803 also required the state board to go through all of their cite and fine regulations and streamline them and be specific only to direct consumer harm implications. So the board has been over the last year doing that very work. And they are trying to put together specific harms with specific violation regulations. So that's happening in real time.
Commissioner Byer.
I appreciate the sophistication of Commissioner Erner's question, but I think it mixes two issues together, which is you don't need to use an administrative law function to separate discipline from licensing. In other words, you could have a separate entity within an occupation that handled discipline that was different. And that offers an opportunity to keep expertise in a profession, but avoids the problem of conflicting interests. In other words, every occupation, there are interpersonal relationships in the licensing process. A person in a small town gets licensed because somebody knows somebody and, well, they're good. But then that goes to a disciplinary board that has the same people. There are potential problems there that could be separated structurally under current law without going to the complexity that you're talking about. So I think the bottom line theme is creating the new department is supposed to free them up to have some creative thinking, and that the trailer bill process is something the legislature could look at in that field in the same way that we've encouraged the housing and homeless people to think about it rather than in the context of the reorg.
All right, gentlemen, thank you very much for your testimony.
Thank you.
So let me, we're going to break for lunch. We'll return at 12:30, and at 12:30, we're scheduled to hear from the Real Estate Association, followed then by the Consumer Federation of California, and then public comment. So see you folks all back here at 12:30.
Check, mic check.
Welcome back, everyone. This is the afternoon session of day 2 of the Little Hoover Commission meeting on the proposed reorganization. And so I will turn it over to Ethan Rarick to introduce our next witness.
Thank you, Mr. Chairman. The first witness this afternoon is Sanjay Wagle, who I believe is coming up to the witness table now. He is Senior Vice President for Governmental Affairs at the California Association of Realtors. Welcome, Mr. Wagle. Once you're settled in, please go ahead and begin your presentation.
Oh, all right. Sorry about that. So I'm Sanjay Wagle with the California Association of Realtors. I'm primarily going to address the issue of placement of the Department of Real Estate within the new body, and just generally with respect to the Department of Real Estate. We are happy with the current functioning of the Department of Real Estate as it stands. Were it to be moved within the reorganization, we are strongly supportive of it going to the BCSA financial portion rather than the housing. And given in the past, we maybe took a different position, but I'm happy to articulate all the reasons why we believe this is where it should go, should the reorganization occur. And let me also mention, we approached this when we first heard about this with a degree of trepidation, given what had happened in the past when the Department of Real Estate was made a bureau under the Department of Consumer Affairs. And I think it's, you're all aware, it was in the reorganization notes, that we had the department, in our opinion, and I think objectively suffered a great deal in that situation for financial and other reasons. So the California Department of Real Estate's primary function is licensing and regulating of real estate professionals. There's over 425,000 salespersons and brokers. We have a strong interest of this. Our association has close to 200,000 licensees and also 26,000 mortgage loan originators. This mirrors the business regulation focus of the new agency, the BCSA. And as the LAA notes, most entities perform a similar function, the licensing and regulation of various occupations and businesses. So we feel this is a logical fit and where it belongs. Keeping it DRE within BCSA would group it with like agencies, such as the Department of Financial Protection and Innovation, where there is somewhat of a degree of overlap in terms of the types of issues they are addressing. So you have, for example, mortgage loan originators are regulated by the DRE. They are also regulated by the Department of Financial Protection and Innovation. There are separate licenses for those functions. Shared consumer protection goals. DRE's mandate is fundamentally about consumer protection in real estate transactions, ensuring competent ethical practitioners and handling consumer complaints. We are a trade organization which is very much in favor of strict, frankly, accountability for licensees, and this function is one of the most primary aspects of importance to our members. This aligns with BCSA's overall mission of safeguarding consumers in the marketplace. BCSA is going to be structured around professional licensure and oversight, so again, logical place for the Department of Real Estate. DRE is similarly special funded by licensing fee, with many similar to some of the other groups in there. And also, we do want to mention that one of the reasons for this focus, which is very important to us, is the real estate market is going through, just like many other areas, a number of changes, just like in taxis or every other area being affected by technology and disruptors. This area is seeing a lot of that. Fiduciary duty obligations, which are very strong for real estate licensees under California law, but you have lots of new models, which, by the way, we have no problem with. Many of those new models are members of our association, all good, but often we need to be ensured that the consumers are protected in those transactions as these new models develop. It's one thing to, worst case scenario, in other types of areas, you might lose $30 in your Uber ride or something like that. But a home, median home price, well over $800,000 in California. Synergy with the professional boards, as I mentioned, under BCSA, DRE can leverage common enforcement practices, legal support, data sharing with other licensing bodies, especially with respect to, we believe, the Department of Business Innovation. We also think that another reason for the logical fit there is there's minimal overlap with the actual Housing, Finance, and Homeless agency that has as proposed. These are distinct policy areas from CHHA's focus. The proposed California Housing and Homeless Agency is designed primarily to consolidate housing development, finance, and homelessness programs, moving the various agencies, Housing Community Development, Finance Agency, CalHFA, et cetera, and the Interagency Council of Homelessness under one roof. The focus on funding affordable housing developments, coordinating homeless services, enforcing fair housing laws. In contrast, DRE does not administer housing construction grants, homeless programs, or housing finance. Its primary role is, again, regulating real estate transactions and professionals. There's no direct programmatic overlap. That would be gained by putting the DRE into the housing and homelessness side. Different functions, while DRE obviously addresses housings, they do it in very different ways. Again, licensing of real estate agencies, agents, mortgage brokers, not administering financing programs for first-time home buyers, et cetera. Simply put, DRE's contribution, ensuring competent real estate brokers, honest sales practices, ensuring consumers are protected within subdivision sales, are not funding or social services. That contribution does not points against DRE sitting within the housing agency. They can support any housing goals that might be appropriate by coordination with BCSA and the new housing organization, especially with the focus on homelessness that is especially outside of DRE's ambit completely, and especially if that's going to be a focus, which it logically would be, and of the other agency, it does not fit at all. As I mentioned, we approach this with a bit of trepidation with respect to any reorganization, but based on our review of all of the reorganization plan, we do believe it takes account of the problems that occurred when the department was made a bureau under DCA, and has adequately addressed that. So we are not concerned about if it is moved. Again, it's already stated within your documents for this hearing about the problems that the Department of Real Estate had when it was made into a bureau. The special funds had to shoulder a hefty pro rata charge from DCA Central Services, which diverted money away from DRE's core functions. Those overhead costs kept growing and potentially was going to start diverting, and probably did, from licensing, enforcement, and other core tasks of the Department of Real Estate. Hence our concern about this. And again, it was clearly recognized because it was Governor Brown, and we supported the move originally to the department, making the department a bureau under Consumer Affairs. And Governor Brown also signed the legislation to take it out, recognizing the problems that had occurred there. In this case, there is no mega department. It remains its department status. It does not become a bureau within this new agency. Any shared services seem at a far lighter touch than resulted in the heavy pro rata cost allocations that happen under DCA. Therefore, we are comfortable that DRE will be able to retain its independence and necessary functioning under the new department. Operational, based on the proposals, the operational independence of DRE does appear to be, is going to continue to operate with its own dedicated staff and budget and statutory powers, just under the BCSA umbrella, retain many of its existing functions intact. Nothing in the reorganization plan alters DRE's internal structure or programs. All of this are extremely important to us. Guaranteed day-to-day regulatory work will not be subject to interference from housing, from outside interference.
Let me interrupt you for just a
Sure.
minute. Commissioner Byer.
Yes.
Welcome. One of my fellow commissioners used an artificial intelligence program to summarize all the submissions, which was then put into a podcast, which you could listen to in 6 minutes. So I'm going to try and get a little deeper than the podcast.
Oh, sure.
So one of the goals of any reorganization is that there's a vision and that the vision has a concrete outcome for the citizens of California. So I'm just going to stipulate that efficiency and streamlining and one-stop shopping are all virtues, but they're not a vision. So if the outcome that we're looking for is lowering costs for consumers or participants in the various regulated functions, would it be safe to say that affordability in the purchasing of homes? Sorry. Affordability in buying a home is a factor. And isn't the biggest change in housing affordability for real estate the reduction in the 6% real estate charge as a result of antitrust litigation?
Wait, with respect to the first part, did you say that would result in the change?
Yeah, in other words, isn't the biggest thing that's happened in real estate the antitrust result for real estate brokers?
Well, I can speak to that to some extent.
How has the world changed as a result of a reduction of from 6% to 3 or 4%? Has that been a good thing for consumers?
Well, so let me.
That's a simple question. Yes or no? Is it good or bad?
Well, I'm going to state that I don't think that's an accurate statement of what's happened.
Okay. What's the fee now?
There is no set fee. There's
Yeah.
never been a set fee. It's always been a negotiable fee.
Okay. So the court found it was 6%. So you might have your
Wait,
opinion. So
Sorry.
what was it before? What is it now? Is it lower? And is that better for consumers?
So once again, I'm going to state there was never a set fee. There's never been a set fee in this state. And when you say the court, this was a court in Missouri. So it did not address California at all. It's a different state, different situation. In California, we have never had, fees have always been negotiated. They are clearly stated on their negotiation that they are negotiable. In most of the state, they have not been 6% for quite a while. There is no standard fee and there never has been. It's always been a negotiated fee. Now, if there has been a change in the way the industry is structured, what that will result in changes, we don't know yet. So I cannot speak to your comment about, isn't it better that they're paying a certain fee? Because I actually do not know what the current average fee is.
Okay. So it's a regulated industry that doesn't regulate the fee.
Correct.
Okay. And is that a good outcome for consumers?
Yes.
Because it's the lowest possible for the service rendered? I'm confused.
It's a freely negotiated fee. There are lots of business
Okay,
models
so
there.
negotiation is between somebody who has either monopoly or monopsony power, the realtor, and a homeowner who has no leverage. Help me understand how that's a negotiation.
There's a complete negotiation. There are a lot of different business models available which exist in the state. There are brokerages which will offer very low fees. The market is out there. The consumer has and does have choice. We disagree.
Okay, but that's fine. But do you think the Department of Consumer Affairs has jurisdiction to regulate real estate fees?
In my opinion, that would be a statutory decision by the state of California.
Okay, and the Real Estate Bureau doesn't have authority to do this either?
In my opinion, no.
So this is a sector of the economy that affects housing affordability that no one has jurisdiction over.
First of all, First of all, you're making an assumption that the commission is affecting the price, which is not necessary, it's not, there's no evidence of that.
Wait a second. The commission doesn't affect the price
No.
to the consumer?
So for example, no, because,
Wait a
Well,
second, you
which-
buy a
which-
$100,000 house and it's, I call it whatever fee, it's 3%. That's a cost to the consumer.
when we've had models, and there are models out there, which are very low cost in terms of how much commission they charge. That is, those models are, the price has not been dependent on the commission. The price is determined by market forces in terms of supply and demand. And if the commission, regardless of the commission structure, that price is not affected based on most studies that we have seen. And I feel we're going far afield from, but I'm happy to continue to answer questions.
So you don't think there's anything wrong with current real estate commissions?
No, because they are freely negotiated. And there are a number of models where you can pay 1% if you wish, or do it yourself,
Okay, in the real world,
which is the real world.
if I can finish, in the real world, what is the average commission paid by California home buyers?
I would have to get that information for you. I do
Isn't
not
that in
know.
the public domain? Isn't there research on it in peer-reviewed journals?
I actually do not know that number.
Okay.
Okay. By keeping DRE under BCSA, the state will not lose DRE's input on housing policy. It would just be channeled differently. The two new agency secretaries will be cabinet level partners, so we expect that to be able to continue to have cross cooperation and discussions when necessary. They can convene on joint task forces. Again, if there's any housing expertise from the DRE that would be necessary, we don't think that their placement within the consumer services side would have any negative, any adverse impact on housing policy. In sum, we do believe the reorganization plan strikes a balance that addresses concerns on both sides. It keeps DRE's mission-focused structure intact, while also enhancing alignment with the state's housing goals through modern administrative practices. And again, unlike the pitfalls of the past, it is not burdened by DRE with mismatched bureaucracy, and again, keeps its department status. We also think that its placement under the BCS will keep its focus on regulatory enforcement without making it potentially more politically charged activities going on in the housing arena, to keep that sort of clear demarcation that it's a regulatory licensing body and not necessarily an advocacy organization. And I think that covers it.
So
Have you taken any other questions?
Thank you. Are there continuing education requirements to maintain a real estate license?
Yes, there are.
Okay,
And-
what do those amount to?
The number of hours?
Yeah, and how often?
I'd have to look that up for.
Okay,
actually.
because attorneys are like 25 hours every 3 years, and that's because, right, I mean, there's changes in the law, there's new things that are introduced. And I would imagine the real estate industry is dynamic, there's new ways to approach issues, there's statutes, for example, that are passed by the legislature. But as you sit here right now, you don't know what that is.
Unfortunately, not offhand, even though I am both a broker and an attorney, and I've done both the continuing education for both. I can't recall the number offhand. And I do want to point out with respect to continuing education, you're right about the dynamic environment. The California Association of Realtors, for example, did sponsor a change to make the fair housing training more robust, and we also sponsored an implicit bias requirement.
Okay. Any other questions or comments from commissioners? Yeah, Commissioner Arner.
When you talk about that, there are a variety now of new kinds of ways of purchasing and all of that. I'm thinking to myself about whether or not the the board gets involved in any policy discussions. And what I'm thinking about is, I hear the same advertisements every day and I get notices run, we can buy your house, just, whatever it is, right? I'm John, I'm your favorite realtor, right? And I'm convinced, I'm presuming that is Blackstone or somebody else behind them. No, people can't raise that kind of money. And then on the other end of it is the programs like Picasso, right? So how does the board get involved in those kinds of discussions to say whether or not we want to have some role to play in this, right? Or to say these kinds of financing mechanisms are okay or they're not okay? I'm interested in where the board that comes down on policy matters.
So at least based on my understanding and with something we're comfortable, the DRE has consistently interpreted, and I think can also issue regulations as necessary, existing statutory laws governing these areas. So for example, you mentioned that one particular model where people are selling effectively shares in a home.
Right.
We actually had concern from some of our licensees whether or not that was legitimate, and we actually at the time, this was a couple of years ago, did talk to the DRE, and this is something they would then have to look at within the existing structure of the timeshare laws. So, and the applicability about how does that fit in? Is it legal under our current laws? And the same thing applies with some of the financing. After the last crisis, for example, most of the thing has been consumer protection. California has extensive disclosure laws, et cetera, with respect to financing. After the last crisis, both federal and state imposed a number of new requirements as to how that would work. Historically, I've seen the DRE often provide information as to those, but it would not take a position outside of their statutory authority.
Having done refinancing over a variety of years, right, and then sitting down to sign the documents, right? I remember they're like 55 pages long. I put my initials on almost every page, right? The presumption that I was reading those, of course, we all know, right? Even if you're a good lawyer, right? I never forget my parents' lawyer saying, my parents actually said to their lawyer, we went before we signed, what do you think? And he was an antitrust lawyer. He was not a real estate lawyer, but he said, you have to be joking if you think that everybody is reading all these documents. They're not, right? And the legislature just keeps adding. I'm sure I did a bill probably to add another page. I don't remember anymore. But whether, some of it, does the board have any educational responsibilities for consumers? If you've wanted to stay in the Department of Consumer Affairs, that side, what does the board do in regards to educating consumers about how to buy a home and all of those kinds of things?
So staying within the consumer side, the Department of Real Estate does actually have an extensive series of publications within their website. And I can speak to, we will refer, for example, our licensees to those publications to distribute at times to their clients. So there is actually a robust amount of public-facing materials, especially in the loan context. And actually going to your point with respect to, as you mentioned, the scale of your loan documents. First of all, a lot of that's also federal regulation comes into play with a lot of that. And also why you have requirements, especially within, and these are both federal, and there's I think a mortgage loan disclosure statement under state law, and the good faith estimate under federal law, why you often end up with these one-page summaries, frankly, so that at least interest rate payment, that the most, in a sense, the most vital parts are covered. And if it's the traditional home loan, you do have a panoply of federal laws to basically protect even within those extended, and state law within that extended package. But that's why I think you also do have these summary documents that now are often very typical, even within the purchase contracts that are generated by the California Association of Realtors. Because as you mentioned, due to more and more regulation, frankly, that's what drives our forms. And that drives the size of these are the legislation, right? We often see more and more disclosure laws, which is all protective, but at the same time, it's expanding the scale. I used to be on our association's legal hotline where I would give advice on our contract. And I used to sort of say, one day, because I thought I'd be there forever, one day, this will be 20 pages. And many years ago, it was a half a page, right? And people would just sort of fill out stuff. So, but I think that's also why even on our new contracts, now we have a summary page so that people can get the key terms down. And if they are inclined, they will read, hopefully, the whole thing. But, yeah.
I see no other questions or comments from commissioners. Thank you so very much for your presentation.
Thank you so much.
Appreciated.
Thank you.
Thank you, Mr. Chairman. Our next witness is Robert Herrell, who is Executive Director of the Consumer Federation of California. Mr. Herrell will be the last witness before we take public comment. If there's anyone in the room who wishes to make public comment, the forms are at the back corner back there. Crystal's raising her hand. So please fill out a form and give it to Crystal, and that will be brought up to me. If you're online, of course, use the raised hand function in Zoom. We'll go to public comment after Mr. Herrell.
Welcome.
Mr. Herrell.
Thank you very much, Mr. Chairman, Vice Chairman, Commissioners. My name is Robert Herrell. I'm the Executive Director of the Consumer Federation of California. And heaven forbid I should be the last person between you and hearing from the members of the public. So I'll try to be relatively brief, but I'm happy to engage with all of you on any questions. And from the portion that I just heard right now, I assume that'll be robust, and I hope it will be. So I've been running the Consumer Federation of California for 5 years. Prior to that, I'd been a deputy insurance commissioner for almost 6 years. I also spent a number of years in the California legislature as a staffer for various committees, going all the way back. And Commissioner Erner, I'm looking at you when I say this, to John Vasconcelos's reign at the Ways and Means Committee. So I've just now dated myself significantly by uttering that sentence. I've also had some private sector experience working as a VP for a double bottom line Latino-focused internet startup. So I'd like to think that it's not, while I'm here representing consumers, I hope I bring a depth and breadth of experience both inside and outside government at various levels that may or may not, you'll determine, be useful to the conversation. I'd like to maybe sort of briefly bifurcate my comments into two general areas. One is the, I think, more narrow task that you all have here as members of the commission and your obligation to send a report and that whole process that has been teed up by the GRP. GRPs, historically, by their very nature, are not meant to necessarily be additive in terms of function and things like that or value. They're more, and I don't mean this in a derogatory way, they're more about rearranging boxes in a certain manner that either brings efficiency or, as the commissioner just said a few moments ago, a vision, something like that. Obviously, yesterday you heard from a whole bunch of experts about the housing piece. You know, just based on my sense of what the governor himself has said and what he's been emphasizing and focusing on, it's clear to me that the primary emphasis appears to be more on that piece. And you probably heard things yesterday that buttress that. That doesn't mean that today's hearing is any less important. In certain ways, this is not just the leftovers, if you will. These are important entities that have really important functions to serve. So there's the GRP part of it, but I'd be remiss and really kind of not doing my job if I didn't also speak a little bit to, especially in a couple of key areas within the new proposed agency, where I think there should be significant consideration to some additive functions, especially given the moment that we're in. And I'll get to that in a moment. In terms of the structure itself, I do think that there's a couple of pieces that I either don't have significant expertise in and don't feel it's right for me to comment in detail on. I think it's a fair question where the Department of Real Estate should go. I could hear an argument to be made for where the governor and the GRP proposes it. I could also make an argument on the other side. I'm really more agnostic on that. I will say, however, that as the head of the Consumer Federation of California, when we have occasionally interacted with the Department of Real Estate, I have not found it to be a department that has a particularly pro-consumer focus. Now, I don't want that to be taken too far, but I do think that it's sort of not how they think of themselves and their mission. And maybe that ought to be a little different. Maybe not, but I do think that that's a context I want to leave there. I'd like to maybe focus on what I feel are the two major components of the new agency that I think derive or have the potential to derive the most value to consumers. And that is the Department of Financial Protection and Innovation, DFPI, and also the Department of Consumer Affairs. Let me begin with DFPI. So DFPI, as you know, and as you've got background documents to give you context for, this was kind of regenerated in 2020 from the old Department of Business Oversight, and there was previous Department of Corporations merged into that, et cetera. It's a merger of a merger of a merger at some level, you could argue. But their primary function is they're the regulator for state-chartered banks and credit unions. This is terribly important. Then what we did also in 2020, and I say we because the Consumer Fed of California was one of the organizations that wanted to recast what is now DFPI into their current role to make sure that when you look at the growth and changes in the economy over the past, say, 20 years, and you see so many other entities, be they fintechs, be they the existence of crypto and digital financial assets, be it non-banks doing services that certainly look and feel to the average consumer like banking services, but they're not regulated in a certain way. We wanted to make sure that those could all be captured within that if you were in the financial products and services business writ large, that is, that you would be under their umbrella to a certain degree. With that comes all kinds of authority, including what we refer to as UDAP authority, which is unfair deceptive acts and practices, which is terribly, terribly important to our existence and making sure that consumers are protected. And I think that while I think putting DFPI in the agency as it's arranged is perfectly fine, I have no quibble whatsoever with the existence of that box, if you will, within the GRP. I do think that with DFPI, we must meet the moment. And what do I mean by meet the moment? What I mean is literally last week, the new leadership at the Federal Consumer Financial Protection Bureau, of which DFPI is to a certain degree modeled on as a sort of quasi-state version of that, attempted to do an almost 90% reduction in force. That is to say, 1,483 of the people who work for the Federal Consumer Financial Protection Bureau were going to be laid off or fired, pick your verb. And that's out of a denominator of about 1,700, give or take. That is a massive, massive reduction in oversight, in consumer protection, in a whole range of functions. And in doing so, I should be clear that the current leadership of the CFPB in the new administration said that their view is that much of what had been done at the federal level is going to be appropriately shifted over to the state level. So for us to have this GRP pending and not recognize that moment when it comes to DFPI and the role that they play, I think that would be extremely short-sighted of us. And so I would urge the commission in as strong terms as possible to help meet that moment, because otherwise the GRP may be well and fine in terms of where DFPI fits in the boxes, but we will then view it as a giant missed opportunity. And what I mean by that is, to be clear, DFPI is not getting authority over federally chartered banks and credit unions. They are not. They have federal regulators. We can argue about their efficacy or lack thereof, and that's a sort of another conversation for another day, perhaps. But it's clear that a lot of the other things are not going to be happening. CFC certainly partnered very closely with the CFPB over the past few years on a wide range of issues, junk and hidden fees, things that literally, Commissioner Arender in particular, help consumers save money, be more aware of transactions they're getting into, understand the repercussions thereof. We also work closely with the FTC on a wide range of issues, which has a lot of consumer importance. There is no exact corollary at the state level.
I just want to add something at this point, and I apologize if commissioners, if I jumped ahead of someone. But when I was chair of banking in the assembly, one of the refrains that was the favorite by the advocates of the banking industry was preemption. That the feds, you can't do that at the state because the feds occupy that field. So can you, is this a way for the DFPI to deal with the issue of prevention? Because you just specifically said that it's not involved in the chartering of the federal banks or the credit unions. So the state of California would have authority over what?
Well, under current law, and by the way, Commissioner Nava, you'll be, I don't know, pleased or displeased to know that some things never change. That's still a common argument that I'm certainly involved in when I'm in front of the Banking and Finance Committees in both houses. They have authority over, there's a range of licensees. I won't go through all of them. So the money transmitters and things like that, many of which I know you and the other commissioners know quite well. There's an existing licensing structure, if you will. But at its core, you're talking about state chartered banks and credit unions and not federally chartered. So for the average consumer, as you know, that most of the names that we know, most of the companies that are doing multi-million-dollar ad campaigns that you would see either on TV or digitally or any other way tend to be, not always, but tend to be federally chartered banks or credit unions, but not always. And per the reorg, reorg probably isn't the right word to use in front of this commission. Per the legislation of 2020 by then Assembly member, now Senator Limon, they were given the responsibility also to deal with other financial products and services that may have otherwise sort of fallen through the cracks, if you will. And so that, those are terribly important functions because, as I mentioned a few moments ago, that's where the real growth is in financial products and services. That's not to say that there aren't interesting things happening maybe with state chartered banks and credit unions. There certainly are and can be, and we can talk about that. But particularly when it comes to other entities that aren't a state chartered bank or a state chartered credit union, or for that matter, a federally chartered bank or credit union, that are coming onto the scene in a massive way. And I'm reluctant to say names because there's a lot of them and I'll miss some, but we kind of know who they are. These are entities that many of them are particularly being aggressive with younger consumers, with kind of Gen Z consumers because of the different way that they think about the banking world or what they have. Now, mind you, lost in the shuffle is this notion that depending on who you're going with and what you're doing with them, you probably don't have federal FDIC insurance protection, things like that. That's a lesson sometimes learned by consumers the hard way at the back end. And don't get me started about risks in the crypto space. That's a whole nother topic. But the notion is that you don't have the same protections. Having said that, Chairman Nava, there are a lot of interesting things going on in terms of state chartered banks and credit unions. DFPI itself does an annual report on overdraft and NSF or non-sufficient funds revenue coming from those state chartered banks and credit unions that they have responsibility over. And particularly when it comes to state chartered credit unions, what's really shocking is the significant amount of revenue that is being generated by those entities from overdraft fees and non-sufficient fund fees. So we're talking about something that costs them less than $1, in some cases much less than $1, but they're charging the consumer $35 or more. So I guess the point I'm making about DFPI is it's really important to not just look at it as a box being moved from here to here. Seems appropriate enough to me on the surface, but what are they doing? Especially given what they're now kind of, maybe without the tools, being tasked additionally to do by the federal government. And so that's something I think the commission would be well advised to spend some time on. I want to just, go ahead.
Commissioner Byer.
Thank you, Chair Nava, for raising the question you did. I want to see if I understand this correctly, and sorry for going back in history, but the Second National Bank of America, like 1820, was a political problem in the 1930s. Regulating federal banks versus state charter banks was a problem. So we have a long history of tension between state and federal government and matters affecting consumers by financial institutions of whatever legal stripe and the need to have some consumer protection. So I want to understand your testimony. You're saying that in conjunction with the reorganization, you would be advocating that we urge the legislature to provide substantive rights or remedies to deal with the technological advances where by cryptocurrency or other financial transactions which were previously not captured by a regulatory scheme are now captured by the institution that got reformed in 2020. Is that essentially your?
To a certain
point?
degree. Now, in some of those areas, Commissioner Byer, you do have, for example, there was state legislation that will take full effect on July 1 of 2026 in terms of the licensing of cryptocurrency companies. It's as part of the DFAL, the Digital Financial Assets Law, was ultimately now Senator, then Assemblymember Grayson's AB 39 of a couple of years ago. But in some of these other areas.
And who's regulating?
Well, that will be DFPI, and they are in the process right now of standing up that program. And given the context here, not only do they have their own needs in terms of following what the legislature on an overwhelmingly bipartisan basis, to be clear, had said that they want to see some protections in this area, but you also have this additional potential shift, right? Cryptocurrency is a tricky one because at the federal level, you have a number of entities that may or may not have some jurisdiction, SEC, the Commodities Trading Commission, et
I
cetera.
mean, the authority that they're saying they're not going to exercise.
Well, yeah, I mean that, and I'm trying not to add editorial comment there.
No, I'm just reading the
literally-
newspapers.
I'm quoting what they said when they tried to take actions last week. And by the way, that the 1,483 people
Right.
who were on the chopping block, that's been temporarily stayed by a federal judge. But you know, obviously stay tuned, more to come on that, we know. So I'm just making the broader point that if you look at both reports, the LAO report I know goes into how many PYs you have at different entities and things like that as you move the boxes around, if you will. I feel like it's 800 or 900, something in that neighborhood. I think that when you consider not only where the growth has been in the economy, where the changes have been in the economy, where there are consumer protection gaps in the economy in our point of view, and also this more recent kind of shifting, explicit, implicit, both, not with resources. It's not like CFPB said, we're going to lay off 1,483 people. And by the way, we're going to shift those resources down to the states so that they can take care of a lot of these things, although we know it's tricky about federally chartered banks. And they're not saying that. They're saying, good luck to you.
Right.
Do this too. And so I think that's a context that's really important for DFPI. So.
Mr. Miller?
Yeah, thank you. I do think it's important that we kind of keep our focus here for two reasons. One, you know, we're talking about state chartered and not federally chartered. And so what I'd like to do, Mr. Herrell, is make sure that we're really focusing on how and what you see the advantages are to consumer protection. I do agree with you. We spent a lot of time on housing. I think there's lots of reasons to focus on the consumer protection pieces. I do want to make sure, we spoke yesterday a lot about incrementalism. We're not here to fix everything. So what I think is really important is that we understand kind of what we can do within this context. And I certainly, I do think going too far on, especially on what's going on in the federal government, actually doesn't necessarily benefit us here, especially because what I'd like us to, if we're going to get educated outside of our mandate, I think it's really important we understand where the state and federal mandates for banks especially are, because when those are conflated, I actually think that's how consumers have lost in this state previously. So I do want to make sure, and I offer this, that we focus on what we can accomplish within this, because when we try and accomplish everything, I actually think consumers end up losing. So I'd love to just make sure that that focus is there. And then I do just want to say, I think ad hominem attacks on a department without additional background, I say this on the Department of Real Estate Bureau, excuse me. I think it's just really important that we're able to back up things like that. If you have data on why you don't feel like it's protected consumers, I think that would be really helpful to see. But I think just saying those words is quite an accusation without something more. So I can see you're eager to talk.
No, I appreciate that, Commissioner Miller. I probably resist the characterization of it as an ad hominem attack. I was just, since you had spent, at least since I walked in the room, 20 minutes with the previous witness, I was offering that I was pretty agnostic about where that box should go. I think you can make a case for it going in the housing space. You probably heard that yesterday, or in the other space.
Mhm.
But that.
Yeah, no, I heard that. I think it was the piece that in your experience,
Well,
they
we-
have not protected consumers.
Well,
So
we-
what I
we-
would invite you to do,
Okay.
I don't want to litigate that now. What I
Okay.
would invite you to do is just send comments in writing
Sure.
and perhaps back that up. And I would encourage you to actually reach out to the administration and have those conversations.
Sure.
Thank
Yeah,
you.
it's mostly in the foreclosure and foreclosure avoidance space that we've
Great.
interacted
So
with them.
would appreciate more information
Sure.
on that.
The, and I appreciate your point. Your larger point, the more important point, I think, which was, I am not in any way, shape, or form, Commissioner, suggesting that you're the be all end all and we're going to, reshape the world with rainbows and unicorns. But I do think that realistically, it's why I've emphasized DFPI, because I think it's terribly important, the work that they're doing. I think their resources, I think, my 2 cents worth and working with them regularly on a wide range of issues is that they need more resources in that department. And at the same time, when you're reorganizing agencies and you have this other challenge, and I've really tried not to comment on that challenge. I've literally repeated the words that were said as certain things were attempting to happen or not happen at the federal level, that is a context that the commission should be well advised to take into account as you contemplate what your recommendations are to the legislature and continue your statutory role in this process. I think that's the only point I was making there, and I appreciate the comments very much. I would just like to spend. There's other areas that, like I said, CFC does not interact with a whole ton. I'm probably not the person that you want to hear thoughts about how cannabis control is going or not going. That's not our bailiwick, and I don't mean that in sort of a humorous way either. I just mean that that's just not an entity. There are other folks who clearly have expertise in that space. I would just like to briefly, before I close, and I'm happy to take more comments and questions, Chairman Nava, to speak a little bit about the Department of Consumer Affairs. There have always been challenges going back Democratic, Republican administrations, decades, with how effective the Department of Consumer Affairs is and how it should be organized. I'll give you one example from very early in my career. I remember, and this is a long time ago before she got elected to Congress, having conversations with then Assembly Member Maxine Waters about private post-secondary institutions and how they ought to be regulated and what they ought to be doing or not. That's a bureau over in DCA that has had a really, really challenging time going back decades, not only fulfilling their mission, but really, trying to protect consumers, especially in that space, consumers that tend to be low and moderate income, younger, in communities of color, who are looking for opportunities for personal, educational, and professional advancement. And far too often we've seen them get, kind of ripped off and scammed. And there's many examples of that with plenty of receipts. And that's just one entity, right? You always have that normal push and pull about some of the professional licensing entities and how independent they are. It's not lost on me, this debate between a board and a bureau may seem very esoteric to the general public, but it actually matters quite a bit when you think about a professional and what they have to go through and what their obligations and responsibilities are and what the consumer protection obligations and responsibilities are of the state. So I think for me, that's the second most important, and for Consumer Fed of California entity to spend some attention on. It's clearly, in terms of the boxes, it's clearly correctly aligned in terms of going in this agency. There's no argument that could be made to put it in the housing agency. Even if you might say, well, there's a particular board or bureau where you could have a conversation. I think that's much more of a DRE kind of where should that go conversation. But I do think that that's another entity where I think that it's almost like maybe contemplating a reorg within a reorg, right? I think it has been a while since we've taken a fresh look at some of the Department of Consumer Affairs functions. And I say that in a very positive way, in that those are really important things that need to be done, that far too often consumers just kind of take for granted. When you do this, this is going to happen, and you have to assume that the person who's going to provide this product or service to you or do this thing is trained and licensed, and they're going to do what they need. And there are certain areas where that's been an ongoing challenge in the home improvement industry, the construction industry, for example, others that I know the chairman himself knows all too well from his career. So I would just close with that. I didn't want to take up too much of your time, and I do appreciate Commissioner Miller your comments very much. And I always try to be careful to not overstate, but I can speak to my experience and CFC's experience with some of these entities. But I'm happy to engage more. It's an important role, and I do think that there's a moment here, especially when it comes to DFPI, that should not be missed. So
Yeah,
thank you for that.
Look, I don't think we're too far afield to say that the idea that federal agencies are going to be as vigorously pro-consumer moving forward as compared to what it has been in the past. If only from what we see in the various agencies where people have been laid off by the thousands and told to go away. And so, you know, rather than a direct assault on those agencies that have responsibilities to provide services to consumers, then instead of a direct assault, what you end up doing is you cripple the agency so that it can't effectively perform the services. And I don't think it's unreasonable to think that some of the burden of providing protection for consumers will fall to the state, because consumers are not going to be able to go to the feds to get the kind of help that they would have received in the past. And I just think that's sort of the temperature out there. And I think it's right. I think we live in a state that has high regard for consumer protection. And I think administrations in California have demonstrated that they place a high value on that. The Senator Lamone is my senator, and I was really excited to see that she ended up taking banking after I left and I had banking. And her heart's in the right place, and the direction that she's taking makes a lot of sense. And I don't think it hurts for us. I think what you're saying is that there are going to be opportunities moving forward that we can't take for granted, that there are going to be additional burdens for the agency under a reorganization, and not necessarily just for consumer affairs, but for others as well in the state. And that we have to be keen in appreciating that it does represent a challenge, but it also represents an opportunity.
I agree completely, Mr. Chairman. And I would just also note, which I didn't point out, but which I'm sure you know and you've seen in the background documents, DFPI doesn't get a penny of general fund money. DCA, Consumer Affairs, it's just a tiny amount if I'm remembering historically correctly. It's almost all special funded. And so those are we are not. I am not here advocating for something that's going to be some sort of massive outlay in what I know are very challenging budgetary times.
Mm-hmm.
And also, just to be clear, CFC was extremely laudatory of the current administration at the state level of Governor Newsom when he signed that bill to recreate kind of DBO into DFPI. We thought that was a really important move, and we were pleased to have been a small part of that process. So you're absolutely right, and I do think that to the extent that when you look at the time frame here, and the time frame kind of lines up to the upcoming state fiscal year, and I know there's a sort of lag and delay that's been talked about in the background documentation about when letting things kind of happen, and then you get the efficiencies over time. I do think that time frame is not lost on CFC in terms of some opportunities that might be concurrent with as it begins to roll out, because there is no better time than as you're getting something started to create a kind of new level setting.
Great. All right. Well, thank you for your testimony. Much appreciated.
Thank you all very much.
Oh, I'm sorry. I didn't
Just
see that.
on, Mr. Herrell, on the idea of putting, especially consumer affairs, do you think there'll be a benefit of having a more focused consumer agency and housing agency, like just in terms of the opportunities to recommit to the focus on consumer protection?
Commissioner Miller, I think the opportunity is there. I don't think it guarantees a result. It's clear that, and I don't say this in a pejorative way, it's clear that some of the consumer affairs probably hasn't benefited over the past decade or so as much as we would have hoped with the last kind of reorg. I think that opportunity is there. The opportunity is there, though, only to the extent that we, the collective we, all take advantage of that opportunity. But I agree with you. I think the opportunity is there to the extent that it's a bit more narrowly focused, that they could benefit from that. And I think then indirectly consumers could benefit from it. I agree. Thank you.
Thank you. That'll conclude witness testimony before the commission. Now there's the opportunity for public comment.
Thank you, Mr. Chairman. So public comment, as you know, is limited to 3 minutes per speaker, and it will be limited to 1 hour of total public comment if we have that much. We will begin with public comment in the room, taken from the mic again in the aisle. Is there anyone in the room who wishes to make public comment? Seeing none, we will move on to those online. Shara, do we have any raised hands online?
Yes, our first speaker will be Melvin Cowan. You now have the ability to unmute yourself. Melvin Cowan.
Mr. Cowan, if you can unmute yourself if you wish to make comment.
Oh, yes. Thank you so much.
Go ahead, please.
Thank you. Good afternoon, commissioners. My name is Melvin Cowan. I'm a resident of Solano County and the founder of Enough Housing, a community-rooted initiative working across California to advance equitable housing development. I want to begin by acknowledging Secretary Tamika Knaus and her team for their leadership and championing a reorganization strategy rooted in equity, coordination, and long-term impact. I'm here to support the vision behind Governor Newsom's 2025 Government Reorganization Plan. But the success of this plan will depend not on structure, but on design that intentionally centers access, equity, and implementation. And by implementation, I mean planning, execution, and ongoing monitoring. So I ask, what kind of collaboration will it take to build the California we all deserve? As a BIPOC developer currently leading Legacy Village, a 55-unit permanent supportive housing project in Solano County, grounded in health, workforce, and guaranteed basic income framework centered on the social determinants of health, I've experienced the barriers that stall this work. These aren't theoretical issues. They're daily challenges for developers closest to the crisis. And many of us, especially in smaller counties or rising as first-generation developers, are asking to be invited to a space where we can honor what's already working, learn from it, and build upon it. This is about collective capacity, not competition. And as we heard earlier today, the bureaucracy is heavy, the roles are unclear, and the public is frustrated. But if we truly want to resolve that, we need more than a chainsaw approach, as the California State Association of Counties noted earlier. We need scalpels, precision tools, and that's what I'm offering here. 4 recommendations I urge you to consider. 1, dedicated pre-development funding for first-time and BIPOC developers. 2, a statewide BIPOC developer advisory board to help guide California Housing and Homelessness Agency planning and accountability. 3, streamlined timelines and templates for CEQA, NEPA, zoning verification, site control documentation, utility will serve letters, and ministerial review confirmation. And 4, state-supported technical assistance hubs to support developers in undercapacitated counties, because the financial risk of inaction is real. Delays inflate costs, deepen housing insecurity, and increase public spending on crisis response. But the benefits of action, they're transformational. Economic mobility through job creation and small business engagement, improved public health through housing first solutions, and social resilience through dignity-based development rooted in community. And so imagine a California where every region has a pipeline of local developers with the training, trust, and tools to build in their own communities, where housing policy doesn't just respond to crisis, but actively drives economic mobility, health equity, and social resilience, where new ideas and lived experience aren't sidelined by bureaucracy, but embraced as essential to progress. This reorganization is our chance to design that future, not in silos, but side by side. Thank you all so much for your time today.
Thank you very much, Mr. Cowan. So, Mr. Chairman, I'm told that we have no other people wishing to make public comment this time.
Mr. Chairman, just a closing thought.
Okay.
And it is directed actually to Commissioner Miller. And because we're in public, we can actually have conversations about the substance. So I want to avoid being accused of being in favor of the everything bagel. I asked a lot of questions during the course of the last couple of days to poke, prod, instigate. Personally, I wouldn't advocate all of the things I even raised questions about. But I think the reorganization is a unique opportunity for the administration to articulate the rationale for reorganization in substantive terms, both on the housing and on the consumer side. And I think, speaking for myself, the political key for sustaining government reform is getting a buy-in from all the relevant communities and stakeholders. And we've heard from some, but not all. And so a robust process that accompanies the reorganization plan that says in the next year, the next 3 years, here are our goals, and this is why the reorganization plan is going to advance those goals, would be the impetus to carry this through beyond the current governor's term and sustain the organizational vision with something behind it. And I think that's kind of the theme, at least that I was trying to pursue. It isn't that we should have a long list of the legislature, some omnibus trailer bill, but rather that there's a there after the organization gets reformed.
Okay.
Mr. Chair, if I may respond, I actually agree with that, Mr. Byer. I think the way perhaps to accomplish that, and what I would encourage the commission to consider is our follow-up questions that can be responded to in writing. I do think that could also be a really effective way for us to proceed and to really encourage the thoughtfulness versus a bit of the Socratic method of having people think on their feet. So I think I agree with your goal. I think my thought is how do we get there? And I do think, Mr. Chair, if you were amenable, a third hearing, just so it's all done in public, we would really start to list the additional information that we were looking for if what we're trying to accomplish is this public service to bring stakeholders in and then allow people to comment. I do think that's a way to encourage that participation. So I sincerely do absolutely agree with the goal. I think for me, it's setting that up and setting up the process, agree or disagree, for success in a really respectful way so that we can have it on the record and have this opportunity for all of us to learn and come up with a better product in the end, I think is the only thing I would say. But absolutely, in terms of the process and our ability to metabolize information and then the ability to have reform be lasting, I think those are really good points.
Thank you very much. Having heard that, let's adjourn.